March 12, 2020. The world changed. World Health Organization announced that COVID-19 became a pandemic. Uncertainty arose. So many questions unanswered. How do we proceed? How do we act? How do we end it? As many questions arise, heroes within us heed to the call. It started with planning. Experts, leaders, movers convened because without planning, the next steps may fail. Tough decisions were made, advisories and policies reviewed, advocacies strengthened, surveillance increased, response heightened. Everyone worked together, collaborating, networking. No one was left behind. Governments across borders stood up in command, with conviction, with purpose. Frontliners, backliners, those in the field made sure that people are safe, people are aware, people are protected and in their homes. Without reservation, without doubt, private stakeholders reinforced support, yielded to those in need, using what resources they have: talent, supplies, presence themselves in aid of those in service out front. In reverence to authority, in synergy, citizens followed directives with valor, humor.
We will support you all frontliners.
We will stay at home.
We will stay at home.
We will stay at home.
We will heal as one.
Faith in each other, in their leaders. It is unclear when this will end or how, but seeing how we have worked together and how we will make a difference. The journey may be long, the road may be hard, but as long as we are united, no pandemic will crumble us. Believe in solidarity. There is hope. In the end, we will triumph. In the end, we will beat COVID-19.
Bawal walay mask. Aron dili kit isanitize nato ang atong mga kamot. Aron dili
Distansya og 10 minutos sa kametro. Action base sa sakit. Kaya nato ni.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solution.
B. Bawal walang mask.
Sanitize sa mga kamay. Iwas hawak sa mga bagay.
C. Kumistansya ng isang metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Beat the solution sa COVID-19.
Dako dyan ang kabaguhan sa kaniadto og karon. Karon mas limpyado na ta. Kung dili na magpataka og lakaw kay mahadlok man masakit.
Ang new normal na ginahanglan sa hugot na pagpatuman sa mga kabag-uhan sa atong adlaw-adlaw na mga kinabuhi aron malikayan ang pagkaylap sa COVID-19 virus. Ubos sa new normal, ato ipatuman ang mga nagkalain-lain na pamaagi aron kitang tanan himsog ug protektado sa sakit na dala sa virus. Ang tanan natong mga paningkamot sugdan nato sa atong panimalay. Makita sad nato kini sa mga groceries ug mga tindahan. Sa mga pangpublikong lugar. Sa mga opisina ug gitrabahoan. Sa mga kananan ug hotels. Mga eskwelahan. Mga pampublikong sakayan. Mga simbahan. Sa new normal, ang tanan katawhan nagkahiusa sa tumong na magpabili na maayo ang atong mga panlawas. Nagtinabangay sa paningkamot aron mokunhod ang transmission. Pagpakunhod sa kontak, ug pagpakunhod sa panahon sa gidugayon sa impeksyon.
Sa karon nga panahon dako gyud nawala sa among kita kay tungod aning COVID. Pero salamat lang gyapon sa Ginoo kay naglahutay lang gyapon bisag ingani ang sitwasyon. Busa motuman kita sa mga mando sa gobyerno, sa kabalaod nga para natong gyapon ang kaayuhan.
Mga karaganons, dili paghihapon kita luwas sa COVID-19. Busa ipagkitaan nato nga kita pagayod ang bida ni ini nga sitwasyon. Bawal walay mask. Aron dili kita makatakod o dili usab matakdan. Ay, isanitize nato ang atong mga kamot aron dili masabwag ang virus. D. Distansya og 10 minuto sa kametro gikan sa usag-usag. A. Action base sa sakto nga impormasyon. Pinaagi ni ini mga kaigsuunan kita maghatag og inspirasyon ug dugang kadasig sa atong mga healthcare o frontline workers aron masugpo nato king dako nga hagit nga atong giatubang karon. Kung kita magnabangay o magtimbayayungay sa atong mga paningkamot, dili kay kita mapakya sa atong tinuhag tumong sa pagsugpo sa COVID-19 crisis dinhi sa atong nasod. Kaya nato ni.
Mga karaganons, ang new normal mao nang atong bag-ong kinabuhi. Magbag-o na kita.
Nagadumdum pa ka sa una kadtong nasakit ka, ako ang nag-atiman sa imo. Ako ang nagpainom sa imong tambal kung masakit ka. Lutuan ta ka sa imong paborito nga pagkaon aron mo baskog ka. Giatiman ta ka ug maayo kay dili ko gusto masakit ka. Sa panahon sa COVID-19, unta na ikaw ang muatiman sab kanako. Unta na magpabilin ka sa pagpuyo sa balay. Anak, pagpuyo sa balay para sa ako.
Ginaugasan ako akong mga kamot sa dili pa og kung humanyamukaw. Ginatabunan ako akong uba kung ubo. Dili sa ko magkikita sa akong mga kadula ug mga classmates. Mutuo ko ni kining gamay na sakripisyo, dako og tabang sa kauban kong mga Pilipino. Kung kaya sa mga batang parehas nako, sigurado kaya sab ninyo.
Sa bahay nagsisimula ang kaalaman at paghahanda. Kasabay ng muling pagsisimula natin ay ang bagong pamumuhay para sa ikabubuti ng lahat. Huwag kalimutan na tuwing aalis ng bahay, magdala ng alkohol o sanitizer. Magsuot ng face mask kapag kinakailangan. Sundin ang mga panuntunan ng pampublikong sasakyan, lalo na ang physical distancing. Sumunod sa safety measures na pinatutupad ng pinagtatrabahuhan. Mag-disinfect ng mga gamit bago magsimula ng trabaho. Kung may meeting, panatilihin ang physical distancing. O kung maaari, gawin ito online. At kapag tapos na sa maghapong trabaho, siguraduhing malinis ang lahat para makaiwas sa sakit. Kung may nabago man sa aming buhay, ito ay ang pagdudobleng ingat para mapangalagaan ang isa't isa at ang kapwa. Dahil ang natutunan sa bahay ay sandata para sa new normal.
Sa dinami-dami ng usapin ngayon tungkol sa COVID-19, nangingibabaw ang tanong tungkol sa expanded testing. Ano nga ba ang expanded testing? Bago natin sagutin ito, mahalaga munang malaman natin kung ano ang confirmatory test para sa sakit na COVID-19. Ang reverse transcription polymerase chain reaction o RT-PCR ay isang laboratory test na tumutukoy sa mismong virus sa loob ng tao. Ang RT-PCR ang siya lamang test na ginagamit upang makonfirm ang sakit na ito. Kaya nitong alamin kung may virus na sa katawan ng isang tao bago pa man lumabas ang sintomas. Kaya naman sa ating expanded testing, RT-PCR ang ginagamit natin ngayon. Hindi ito katulad ng rapid antibody-based tests o RATs na tumutukoy lamang ng antibodies sa katawan. Sino-sino ang kabilang sa expanded testing? Sa expanded testing, ang mga sumusunod na mga tao na may history of travel sa isang lugar na may COVID-19 o nakisalamuha sa taong may COVID-19 ay sasailalim sa RT-PCR test. Una, mga pasyenteng may malubha at kritikal na kalagayan. Ikalawa, mga pasyenteng may edad 60 pataas, pasyenteng mayroong ibang sakit, o mga pasyenteng may maselang pagbubuntis. Ikatlo, mga pasyenteng may bahagyang sintomas. At ikaapat, iba pa nating kababayan at mga healthcare workers na walang sintomas ngunit may travel history o contact. Mayroon na tayong mga laboratorio na kayang gumawa ng RT-PCR sa Luzon, Visayas at Mindanao. Sa kasalukuyan, layunin ng ating gobyerno na tumaas pa ang health system capacity ng bansa upang matest sina lolo, lola, kuya at ate na pasok sa populasyong kailangan ng testing. Ginagawa natin ito upang mabigyan ng tama at agarang atensyong medikal ang mga pasyente at para matukoy ang iba pang tao na nakasalamuha nila. Mahalaga ang pagpapatest sa paglaban sa pandemya, pero mas mahalaga kung mapapanatili ang kalusugan ng ating katawan. Mas mainam kung lalabanan natin to ng sama-sama. Ika nga, prevention is better than cure. Mag-exercise, kumain ng tama, practice cough etiquette, sundin ang 1 meter rule sa physical distancing, maghugas ng kamay, at higit sa lahat, kung maaari ay magstay at home. Samahan kami sa susunod na video para malaman ang kaibahan ng RT-PCR sa RATs.
Para safe ang pamilya, dapat sa bahay sanitation ang bida. Maging bida solusyon sa COVID-19.
bawal yakap at kiss. Maligo-ligo muna from head and shoulders to feet. At ang damit na yung ginamit, detergent with bleach dapat para ang germs di kumapit sa kids. Maging malinis-linis araw-araw para safe si lolo, lola, ate, kuya. Maging malinis-linis araw-araw para you can be the solusyon. Sa kusina ay hugasan agad ang mga plato. Mas joyful ang salo-salo. Sa mga bagay iwas hawak para iwas hawak. Buong kamay ay hugasan mo na. Walang mask. Isanitize ang kamay. Tumistat sa isang metro. Alamin ang totoo. Maging malinis-linis araw-araw para sa buong pamilya, ako, ikaw. Maging malinis-linis araw-araw para you can be the solution. Isanitize ang katawan at buong bahay para you can be the solution. Simula sa bahay, maging malinis, 'cause together we can all be the solusyon. Be the solusyon. Be the solution.
Good news, Ma'am Shi! May libreng dagdag bakuna laban sa polio, tigdas at rubella o tigdas hangin para sa mga batang wala pang 5 taong gulang. Pwede ba yan kahit may COVID-19 pandemic? Pwedeng-pwede at kailangan ito ng ating mga anak. Patuloy kasi ang polio outbreak simula noong Setyembre 2019. Tapos dumadami ang kaso ng tigdas hangin at baka mag-outbreak pa raw ng tigdas. Kaya mahalagang mabigyan ng mga bata ng proteksyon sa pamamagitan ng bakuna. Napabakunahan na ata ng nanay ko si buboy ko. Di ko nga matandaan eh. Baka mapasama kapag umulit. Mas mabuti na ang sigurado. Walang masama kung maulit ang bakuna ngayon. Walang tinatawag na over-vaccination o overdose. Ang bawat dagdag na dose ay dagdag proteksyon din sa inyong anak. Uy, ang dami mo namang alam. Ikaw na ang magaling. Sigurado ka ba dyan? Oo naman. Lahat ng sinabi ko sa'yo, mga sagot din sa akin ng taga-health center kanina. Nagpunta ka na ba? Di ba dapat hindi tayo naglalalabas? Tama ka naman, Mars. Pero ang pagkuha ng health services katulad ng bakuna ay isa sa mga tinatawag na essential reasons. Pinapayagan ng mga ito dahil mahalaga silang gawain sa buhay. Gawin lang natin ang mga pag-iingat katulad ng pagsuot ng face mask at face shield at tumuloy lang kung tayo ay walang sintomas ng anumang sakit. Meron tayong mga protocol para maging safe ang lahat. Mahigpit sa physical distancing, limitado ang bilang ng nakakapasok, at open space o may tamang ventilasyon ng venue. Palagi ding dinidisinfect ang lugar. Sa health center, hiwalay din ang mga nagpapabakuna sa lugar ng mga nagpapagamot ng ibang sakit para makaiwas sa hawaan. Yung mga staff doon, syempre naka-face mask at face shield din, naglilinis pati sila ng mga kamay bago at pagkatapos magbakuna. At ang pinaka-importante, maingat na maingat sila sa pagpapatak ng bakuna kontra polio. Sinisiguro nila na hindi lumalapat ang dropper sa kahit anong parte ng bibig ng mga bata para safe at walang contamination. Sigurado bang pang polio at tigdas lang ibibigay dyan? May nabasa ako sa social media. Huwag ka masyadong magpapaniwala sa nababasa mo sa social media o sa mga sabi-sabi, Mars. Lalo na kung tungkol sa kalusugan natin at ng ating mga anak. Kumpirmahin muna sa mga kinauukulan. Unahan na kita. Pag nagkaroon ng konting sinat, panayad na pamamantal o pamumula sa pinagbakunahan, normal lang na mga reaksyon nito at hindi dapat ikabahala dahil mawawala din ito. At kumonsulta lamang sa doktor o tumawag sa health workers kapag lumala at tumagal ito. Tama, Mars? Ayan, may tama ka ring sinabi. Wala na ako ha, daling ko na si Buboy para magpapakuna.
Good morning, Caraga, and to all parts of the Philippines where this podcast can reach. Maayong adlaw mga Karaganon, ug niya na usab ang inyong Department of Health Caraga para maghatag og mga bagong impormasyon sa panglawas. Welcome to this live webinar of the DOH Caraga entitled Keeping Everyone Safe and Healthy in the Workplace Amidst This Pandemic. I am Romelyn Turalba and I am your host for today. So it has been more than 7 months since the COVID-19 pandemic crisis that has been declared. Kumusta naman? It is clearly undeniable that the pandemic has disrupted our work schedules, our routine activities as we work, and for some who are working at home, we all had major adjustments, right? But as I've said, months had already passed by. Some offices are already implementing full manpower complement. For this reason, we want to be guided as how we are going to have a safe and healthy workplace. To all our viewers, we are broadcasting live on Facebook, and this seminar will be soon shown on YouTube. So if you are in your office and you would like to know more about tips on procedures and practices for prevention and management of COVID-19 in the workplace, then stay with us. In a bit, we will provide you the details. Today, we have invited a caliber speaker to present to us the must-knows, must-dos, and healthy practices in workstations. So, stay tuned. Let's start the day by checking how we feel. What's our mood today? Did we get up at the right side of the bed? Tell us how you feel. Vote in. Are you happy? Are you sad? Hungry? Do you feel loved? So please join our pool. Just key in menti.com, that's menti.com, and use the code 1718252. To our participants in Zoom, just code in 1718252, menti.com. Tell us how you feel. Are you happy? Are you sad? Are you hungry? Or do you feel loved today? I'm so excited because this is the first time that DOH CHD Caraga will also be live on Facebook for this webinar session. So we'll be waiting. What's your mood for today? Let's give 20 seconds to all our participants to key in their mood for today. Again, tell us how you feel. Are you happy? Are you sad? Do you feel loved? Do you feel hungry? Personally, I'm excited for today. So join us. That's menti.com with the code 1718252. While we are still finalizing our mood for today, we would like to recognize the presence of Municipal Mayor of the Local Government Unit of Cortez, Mayor Josie Bonifacio, and also with us is Director of DNR-EMB, Director Albert Arcamo. So, good morning po. Ayan, we can already see the mood of our participants for today. We're so happy that a lot of you are happy for today. Some of you are inspired. I'm inspired as well. And a lot of you are excited. When some of you are a bit hungry, and it's sad to know, and it's good to note, that's good to note that none of us are actually sad. Basically, I'm excited right now. It's a mixed emotion of happiness, excitement, and inspired because we will be learning a lot today. We will be given a lot of information in terms of the procedures, practices, and treatment management, especially in the workplace. All right. So again, we have a lot in store for all of our participants today. We are broadcasting live on Facebook, so we are also enjoining our followers on Facebook at DOH Center for Health Development Caraga to join this webinar, this virtual discussion, because there's a lot of information that we will be learning today of the procedures, practices, treatment, and management of COVID-19, especially in the workplace. We'd also like to say hi to the Regional Supervisor of the Food and Drug Administration Caraga, Ms. Perla B. Alpiza. Thank you for being here with us. We'd also like to say hi to PDRRMO Surigao del Norte. Lovely to virtually see you around Provincial Health Office of Surigao del Sur. I'm still checking some of our participants on Facebook. Again, we are broadcasting live on Facebook at the official Facebook page of DOH Center for Health Development Caraga. And we also have our participants at Zoom. So Zoom cloud meeting, so I'd like to wave hi to all of them. So again, just key in your mood for today. What is your emotion? And let's watch some video clips prepared for all of you.
Nagulukit ka ang atong mga kumikanan ng mga enhance sa iyong mga bata 9 months to 59 months. Muli ang interval sa atong mga bata at atong reason.
Handle our environment. We handle the trees much more with human beings. And that is our children, no? So the more na atong palagaon ang atong mga anak, o atong mga apo, o atong katawhan. Supplemental. Walang kailangan naging mag-supplemental ka. Tungod kay na ay mga pipila ka porsyento sa atong mga bata na di gaya nila yun mabuo. No? O nakaproduce sila o kung nang ginaino nato na sundalo o antibody o protection, no? Para sa themselves.
These things the government is doing for us because it believes in the families, in the communities, to make up a healthy and productive nation.
Ang obserbasyon ako karon, at least daghan ang mag-participate sa maong activity karon. Then so far murag positive man ang output karon. Magpasalamat ko sa katong nag-participate.
So I think kaning nga activity dapat i-implement all barangays para malasan ang ato ang
cases, if not zero, at least ma-control ang pagdagan sa dengue cases. As we all know, lisod ba yagid ang kanang dengue treat. So dito ta sa prevention. So dengue out ato ni strengthen nga activity.
Dengue out, posible gyud kaayo ni nga mahitabo sa atong region, no? Kay karon nga activity usa na ka ebidensya nga naay pa naghiusa. Kung naghinaon ni nga kini nga activity dili lang karon kundi ma-sustain gyud sa ato ang matag barangay, komunidad sa ato ang rehiyon. Makausap ba daghan kaayong salamat sa atong mga partners, sa atong mga government agency nga misalmot sa barangay officials ug sa mga katawhan diri sa barangay sa Libertad ug labi na kay Kapitan Minchin Surya Rosario sa iya hapon nga pagtugot alang kanato nga dinhi nato himuon ang relaunching sa ato ang 4 o'clock habit.
You know when I come back, you know what it look like. Everything lit, all the girls in free. Everybody inside, sipping on a good time. You ain't got a risk, they can put it on me. When they wanna go, they know all my money show. I don't ever get it one way, yeah. Spinner then I get it same day, but hey.
Makaigsunan gusto kong mahibaw ka mo nga sa 16 ka region sa Pilipinas, tulo lang ang walay kaso sa dengue nga epidemic level. That would be 11, Davao, 12, Suksarsi, atong pinangga. Karena tigwa ka ito una, may nagpunta ka nalulog. Wala kumpiyansa na tungod sa sobrang so muna ang Department of Health tungod kay 13 kabuhong epidemic aron kita dungan 4 o'clock habit, and that is the regular clinic of also.
Pwede yun nato mapugnan o mapreventahan. Kana pinaagi sa ato ang panaghiusa. Kay dili yun imposible nga mahimong dengue out. Mini kaya nato nga mapagawas ang dengue dinhi sa atong rehiyon o sa tibuok nga Pilipinas. Pinaagi ni ini Enhanced 4S.
So once again, good morning, Caraga, and to all parts of the Philippines where this broadcast can reach. Mayong adlaw again, Caraganon, og niya nausab ang inyong Department of Health, Caraga, para maghatag og mga bagong impormasyong panglawas. So again, we have a lot of in store for all of you today and prizes in between, so don't scroll nor leave. We'd like also to say hi to all our participants at our Zoom Cloud meetings, and to all our viewers who are tuning in live on Facebook. So welcome again to this live virtual webinar entitled Keeping Everyone Safe and Healthy in the Workplace Amidst this Pandemic. So let's check again the mood of our participants. We can see that a lot of us are happy. Some are inspired, some are excited, and well, we have 3 participants who are actually hungry. I'm with you with that. I'm also hungry as well. But we're all excited for this activity, and already in tune of what are the things that we will know for today. So to formally start our activity, may I enjoin everyone for a prayer and for the singing of our national anthem.
Under your grace, your mercy amazes me. Under your wings, your shadow covers me. A promise of love where my heart is safely undone. Speak to me, Lord, your servant is listening. Over the noise, I hear you whispering, my hope has come, and my heart is safely undone. I found my fortress in you, and my soul is anchored with you. My resting place is in your name, forever safe, forever safe, forever safe, forever safe. You are never far away, always reaching out to save my weakness, covered by your strength, and I am found forever safe. You are never far away, always reaching out to save my weakness, covered by your strength, and I am found forever safe. I found my fortress in you, and my soul is anchored with you. My resting place is in your name, forever safe.
Hello once again to all our viewers on Facebook, and of course to our participants at Zoom Cloud meetings. We're back here in the main room, and again we will be discussing topics later about treatment, prevention, and management of COVID-19, especially in the workplace. So I guess we're all very excited for this. Before we proceed, let me present the house rules for our activity. This goes to our participants at our Zoom Cloud meetings. Just a few house rules for all our participants so that we will be reminded of the things that we should follow during the presentation. Let's check this, the house rules. So again, we'd like to say hi to all our viewers who are watching. We are live on Facebook. We'd like to say hi. Again, we'd like to say hi to all our participants. So I go to Melbourne. If you're tuning in. And we'd like also to say hi to all of our friends from the other government agencies who are with us. We'd like to say hi to National Fishing Council of Dagat, Fishing I'd like to say hi to all the officers who are tuning in to live Hello as well to all our the Commission on some of the government agencies are also agencies for us to provide you a little background of occupational health. Occupational health is the field of health, discipline dedicated to well-being and safety of the employees, which is why this webinar is very important in the work. Occupational health services, replacement testing, ergonomics, occupational therapy, and occupational. And we'd like also to see some efforts as well in the office as to how we're going to protect employees from hazards. So, like, especially now that we are in a pandemic crisis, so we look into policies, we look into practices to protect each other, like restructuring of the office, physical distance, and protocols that we want to incorporate in the workplace so that everyone can be protected. Atong kumusta na ang atong mga kabuhingan, sabi na sila nakabulan na nilabay. COVID-19 pandemic. So I personally, I was for a few months because everything was new. So I had major adjustments as to how I'm going to live with the pandemic. But because of the different efforts that I made as well. So I started contacting my friends, of course, physical distancing. I started to call them socially and we were able to talk. Psychosocial debriefing or psychosocial processing is as important as well. So there are a lot of strategies where we can help each other so that we can also mentally cope with the pandemic crisis. But today we will be focusing more on the prevention and management of COVID-19, especially in the workplace. So let's check again. We now have our house rules. So it's a lovely day to learn new things and be open-minded of concepts to help us in the workplace. I hope our participants at the Zoom Cloud meetings are okay and they're able to hear the audio. Second is for our participants, they need to completely fill out the attendance sheet in the chat box. So copies of the presentation and certificates will be sent via email. And we'd like to request our participants to the Zoom Cloud meetings to turn off your microphones while the speaker is presenting. All questions are to be entertained during the open forum. And at the end of the activity, we'd like to request everyone to open your video for photo documentation. Again, welcome to this virtual discussion, this webinar on keeping everyone safe and healthy in the workplace amidst the pandemic. I'd like to walk you through the program flow for today's event. So we've already done with the prayer and the national anthem. Later on, we will have a series of messages, and then we will be updated of the management, prevention, and other practices for COVID-19, especially with COVID-19 in the workplace. So the Department of Health today is actually conducting our immunization program. That's the Chikiting Ligtas. So it started last month, October 26, and it will end on November 25. So we are calling all parents and families who have children aged 9 months to 59 months. So that's about 9 months to 4 years and 11 months to have their children vaccinated to protect them from measles. So the vaccination campaign is still ongoing. So again, we'd like to encourage families and parents to have their children and their kids ages 9 months to 59 months to avail the vaccination campaign. So again, we'd like to say hi to all our viewers, especially to the government offices present here today to watch this live broadcast, requesting as well my colleagues to have also or to give me the list of the different government agencies present today so that we can properly acknowledge them one by one. So once again, we'd like to acknowledge the OIC Director of DNR Director Albert Arcamo. Thank you for being with us. Medical Officer 5 of DOH Caraga, Dr. Ernesto Pareja. And we have the Municipal Mayor of LGU Pertes, Honorable Josie Bonifacio. We'd like as well to acknowledge the rest of our participants present here today. Wave, if you are called, we have the different line agencies with us. We have the Civil Service Commission, we have a representative. Some of our participants are actually in the Zoom cloud meeting. So again, we are live, broadcasting live on Facebook. We also have our friends from Modelo Cerati Memorial Medical Center. Some of the participants coming from the DPWH, from Dole. We'd like to say hi again to our friends from the Provincial Health Office of Surigao del Sur and Provincial DOH Office of Surigao del Sur. We'd like as well to acknowledge the team from FDA Caraga. We also have representatives from DOST, from PPA, and the National Nutrition Council. And so I'm just gonna randomly acknowledge some of the participants who are present today. We also have the OCD and the EMD. So again, thank you for being with us. We will acknowledge you in a while, one by one. So let's talk more about again occupational health. So again, occupational health is a specialized branch of medicine that focuses on the physical and mental well-being of the employees in the workplace. The aim of occupational health is to prevent work-related illness and injury by encouraging safe working practices. So ergonomics, like studying how you work and how you could work better. Occupational health is important because the practice itself can also promote teamwork and aside from protecting the employees physically and mentally. Occupational health services help keep employees healthy and safe while at work. So like karon nga nag-atubang na ta sa COVID-19, we had a lot of restructuring, right? Like kami diri sa office, it's good to see that many establishments are practicing the health protocols. So like when you enter the office or in an establishment, di ba nakita nato nga they check the temperature and then you fill out a form wherein you declare your condition or your status. So it's a good practice because we're able to monitor the condition of our employees. So ang uban, pag sulod sa opisina, i-check ang temperature and then nada yung alcohol. So pagsunod sa office, naatay na physical restructuring nga makita nato and even barrier. So these are some of the practices being done already because of COVID-19. And right now, DOH would also want to highlight our communication handle because for COVID-19, officially, that is the Vida Solution campaign. So I would like to walk you through the Vida Solution campaign. B, bawal walang mask. I, isanitize ang mga kamot. So, kung mahimo pod, dili mo gunit bisan asa. D, distansya o dili mo minus og usa ka metro, and then A, action base sa saktong nga impormasyon. Kung inyong makita, daghan kitag guidelines, right? So, DOH in coordination with other government agencies and with our local government units. Daghan kitag guidelines, but to sum it all up, what's really important are the four elements of the BIDA solution campaign. So I would like to repeat that. BIDA, that's B, bawal walay mask. I, isanitize ang mga kamot. D, distansya og usa ka metro. And A, action base sa saktong impormasyon. We'd like to encourage our viewers and our participants to help us disseminate this communication handle because it will protect each and one of us. It's just as simple as four-letter word of BIDA. So I guess that's easy to remember. And right now, DOH also has a lot of efforts in coordination as well with other offices and with our local government units in terms of really mainstreaming our BIDA campaign as we assign Vida Bastonero. So Vida Bastonero is actually a person who can advocate Vida Solution campaign and other health protocols. So we're closely coordinating with the different LGUs and different offices so that they can have their Vida Bastoneros in their respective areas. This is actually a person who can advocate, inform, remind, and appreciate efforts to maintain health protocols and to be protected from COVID-19. So again, we're live on Facebook. Just key in your comments and questions there, and we'll get everything and cover everything as we can. To formally acknowledge our participants this morning, may we call in now our Environmental and Occupational Health and Safety Regional Coordinator of DOH Caraga. Let's all welcome Engineer Joscoro Navarro. Engineer?
Good morning. We would like to acknowledge our guests and participants from the different government agencies, academe, and other different organizations in participating in these events. So we have here online participants from the Bureau of Jail Management and Penology, from the Bunawan District Hospital, Butuan Medical Center, Caraga Regional Hospital, the Caraga State University, Commission of Human Rights, also the Commission on Audit, Caraga, then the Civil Service Commission, CSU Cabadbaran City, De La Salle John Bosco College, the DNR Regional Office 13, we have also the DNR Environmental Management Bureau, the Department of Agriculture Regional Field Office 13, we have also the DepEd Caraga Region, we have the Department of Foreign Affairs, Davao. We have also the Department of Information, Communication, and Technology. We have also the DICT MC2. We have the DILG Regional Office 13. We have the Municipal Health Officer of Caraga. From the DOH-HD Caraga. We have also participants from the Department of Labor and Employment, the Department of Science and Technology, Regional Office, the Department of Social Welfare and Development. We have also from DTRC Agusan del Sur, DTRC Surigao. We also participants from Eastern Samar State University, from FDE, Food Drug Administration, Caraga Region. We have from the Padre Saturnino Orius University, Hinatuan District Hospital. We have the Integrated Midwives Association of the Philippines. We have the Laguna State Polytechnic University. We have the League of Sanitation Inspector of the Philippines, the Local Government Unit of Caguait, Local Government Unit of Cortes, the Loreto, LGU Loreto, LGU Madrid, LGU Tubay, LGU Carrascal, Madrid District Hospital, NTA, We have also the Office of Civil Defense, Caraga. We have the ONAP. We have also the OSHC Duli. We have the PDEA, Caraga. The Philippine Ports Authority. We have the Provincial Health Office of Agusan del Sur, Surigao del Sur. The PNP, Caraga. Prime Water, Surigao Metropolitan. The Arichio Kitsarao. We have also Arichio Lianga, Arichio San Miguel. We have the Taipan Development Incorporated. We have also the TISDA Surigao del Norte, THPAL, University of Eastern Philippines, and other government employees and employees. So thank you.
Thank you, Engineer Navarro. Once again, we'd like to say thank you to all our participants who joined us at Zoom, and of course, for all our viewers on Facebook. Again, we are live on Facebook for this virtual discussion. We've seen him in our streaming episodes for COVID-19, making sure that all Karaganons are updated not only on the cases, but on the strategies being done to combat the virus. Today, he will formally welcome us to this activity. May I call in Regional Director of DOH Caraga, Dr. Jose R. Lacuna Jr. Director.
Okay. Okay na ko? Maklaro na ko. Excuse me. Am I heard? Okay na? Hello? Mayong buntag kanatong tanan. Greetings of good health and peace from CHD Center for Health Development, Caraga. On behalf of our office, I welcome you all. Dawatan ninyo ako mainiton kay nga pasalamat and welcome for your participation in this very important activity. My friends, we cannot overemphasize the importance of health as an important contribution to our economy. We also take notice that equally important is the economic activity which we have to pursue to sustain us. And in recognition of these important considerations, welcome to this day's event, keeping everyone safe and healthy in the workplace amidst this pandemic. In this virtual discussion, everybody is invited to participate actively, and to contribute something that we will make this program successful. My friends, nalipay ko nga we start this program with all the preventive activities. Indeed, prevention is better than cure. And I would like to emphasize that even with our pandemic, the implementation of the different public health programs did not stop. It continues, but this time under minimum public health protocols. Nakita na to, we still continue on Mr. Sia, measles and rubella immunization activity, supplemental immunization activity. And I'm proud and happy to tell you that as of yesterday, 67% ng accomplishment sa Caraga, number 1 in the whole of Mindanao. As I congratulate all the stakeholders, nagpasalamat ko ninyong tanan sa inyong kooperasyon o commitment. At the same time, my thank you kaayo sa atong mga ginikanan who really go with us in our efforts to make our children 9 to 59 months old healthy and safe from measles. We all know that measles tip dust is a viral infection. It cannot kill, but the complications that it brings, such as bronchopneumonia, will cause our children to die We do not want this to happen to our children, for they are the future leaders of our country, and we have to do everything possible to keep them healthy. My friends, nakita sad nato ang atong efforts on dengue. Dengue fever control is a year-round control measure. Pero tungod sa rainy season, nag-anam kadaghan ang kaso. So we continue with our 4 o'clock habit to keep our environment dry, so to speak, preventing the mosquitoes to multiply. Tungod kay ang mga lamok, mo may magdala sa virus. If there is no career, there will be less incidence of dengue fever. So let us do our part, my friends. We continue cleaning our environment as we protect ourselves by having long sleeves, aron di tama, paakan, and then lotion is very safe, and to have ourselves examined and our children should there be fever 2 days or more, especially so with the current pandemic, so that we can be given instructions and guidance on how to deal with this situation. We continue also our efforts in family planning for safe pregnancies, together with the Commission on Population and Development. We continue also our education about nutrition. You know, guys, when one is healthy, we can almost do anything. And they say that we are what we eat. So kinahanglan ang atong mga pagkaon, kinahanglan according to the guidelines. 10 commandments. Ayaw kalimtin ninyo to follow these guidelines po. We also have programs on environmental control as well as immunization activities. While measles is an important immunization activity, dili na to kalimtang nga duna pay lain nga immunization nga atong gihimo. Polio, DPT, to protect our children from getting the disease so that they will become healthy. My friends, nadunggan ako ganiha, pero wala ako nakit akong personal campaign on PIDA solution. Actually, this is a personal campaign being the director of the Department of Health. I launched 4 months ago. PIDA, pabalik-balik kita ini because this is the only way to prevent and control the transmission of COVID-19. Pabalik-balik na to. Pero gusto lang kong idugang. Katong ay bitaw, bawal walang mask, ay isanitize. Akong idugang ang i-isolate. I made a regional directive that all contact persons of a COVID-19 positive person should be quarantined bar isolated. Quarantine katong mga asymptomatic, isolated katong dunay symptoms. In the face of limited resources of testing, we prioritize katong symptomatic nga contacts, then later on dito sa asymptomatic when the tests are already available. You even hear ganiha nga we will extend our testing guidelines to include those health workers in the facilities, asymptomatic man o dili, for the vulnerable groups such as pregnant women and senior citizens. They are a priority, especially with comorbidities or coexisting diseases like diabetes and hypertension. All things we do to implement the public health programs to keep our people healthy. I would like to thank all the agencies that are involved, especially sa atong local government units. Saludong-saludo ako sa atong mga LCEs who support us through their video messages. Gikan sa governor, gikan sa mayor, because they know that health is an important component of governance. Salamat kay sa inyong cooperation, mga halangdon ng mga LCEs. Of course, my thanks to the local health workers who comprise most of the health force, sa ato mga human resource for health, sa Department of Health, doctors, nurses, midwives, and the rest, and of course, the other extension offices of the Department of Health, PIDUHO, Provincial Department of Health offices in every province and in Butuan City. Salamat kay kaninyo. But most of all, my thanks to the parents, especially the mothers who are willing to have their children immunized because they are our jewels. We have to protect them at all costs so that we will have a healthy Philippines. Remember ang mission sa Department of Health, by 2022, Philippines will one of the healthiest regions in Southeast Asia, and by 2040, one of the healthiest in the whole of Asia. Makaigsuonan, nalipay ko nga we are here together. As I've always emphasized, when we do something together, we can do them better. Together, we can do more. And together, we heal and recover as one. Daghan kayong salamat ug maayong buntag again to everybody. God bless us all.
Thank you, Director Boy. So once again, there you have it. That's our Regional Director, Dr. Jose R. Liacuna Jr. Thank you, sir, for that inspiring message. Once again, we'd like to thank our Regional Director, Dr. Jose R. Liacuna Jr. There you have it, folks. That's our Regional Director. Thank you again for that inspiring message. Allow me to provide to you the mechanics of the open forum later. We understand that some of you might be shy in asking questions and that some of you would want to keep yourselves anonymous. Am I right? In order for us to maximize technology while protecting your identity, you may enter your questions at menti.com with the code 1718252. Once again, that's menti.com with the code 1718252. So when our speaker will be presenting already, perhaps you already have some questions on your mind. You can key in your questions at menti.com. That's menti.com. Menti.com and use the code 1718252 so that when the speaker speaks and presents, you can already have or formulate questions in mind. So later, we will be randomly picking questions. We will randomly pick questions to answer, and hopefully the speaker can cover all the questions at that site. So again, once again, you can key in your questions at menti.com. That's menti.com. Menti.com. Use the code 1718252. And right now, we will now be finally updated of the prevention management and other things that we need to know in the workplace against COVID-19. So let me introduce to you today our speaker. Our speaker for today is Medical Officer 4 of the Disease Prevention and Control Bureau, Occupational Health Disease, all the way from DOH Central Office. Ladies and gentlemen, let's all welcome Dr. Valeriano B. Timbang Jr. Doc, good morning po.
Hello, good morning. Can I be heard? Narinig po ba ako?
Good morning po, Doc, and
Good
it's
morning.
good to have you here with us. Thank you for sparing your busy time for Caraga Region. So I'll now give the floor to our speaker.
Okay, thank you very much. Before anything else, so good morning to everyone. Maayong buntag po sa inyong lahat. To all the officials, government officials, national government agencies who are tuned in, to the officials of the local government unit, and also to dear Director Lacuna of CHD Caraga. Also, congratulations for performing well in the supplemental immunization activities for polio and measles. So I hope that you continue to have that kind of performance. Thank you very much. And then I hope that after this presentation na wala pong magbabago ng mood for our for those who are tuned in, for our participants. Sana po from happy, wag maging sad. But I'm expecting that baka meron po magsabi ng hungry. Kasi po baka po we might spill over. But I'll try my best to keep the presentation short and informative. So please bear with me and I will be sharing my screen. Okay, so okay. To start with the presentation, so this is actually the operational framework on COVID-19 response in workplaces. So it was actually envisioned by Undersecretary Kubutay to be a operational framework for COVID-19 applied to all workplaces for public and private. But since that the Department of Labor and Department of Trade and Industries already issued their guidelines and a supplemental guidelines for COVID response in the private workplace. So it was agreed in the sub-technical working group that this will be um, mainly focused for public sector workplaces. But then again, for the purpose of this presentation, all principles that will be applied or information that will be shared here can actually be implemented for both the public and private. So it will just be all the things that will be mentioned here will be actually non-prescriptive, but can be applied, can be improved, or can be added on by the specific workplace. So since the start of the pandemic, no, so the government has already uh, actually drafted and enacted National Action Plan against COVID-19. So now we are actually on the phase three of the COVID-19. Both phase two and phase three are actually directed towards um, recovery, as many of our industries were affected by the pandemic, and actually that goes with it our economy. So now that we will be opening up a lot of our industries and other sectors, so it's really important that we have things or principles in place for the prevention of the transmission of COVID-19 in the workplace. So actually, we have so many strategies that were implemented before. No? So from the National Task Force, we have the community-based and localized health event management approach, or the hammer and dance, using the PDIPR strategy. And we have the DOH strategic refresh. And we have the DTI Joint Memorandum Circular for COVID-19 response in the workplace. And then what you can see in this on the screen right now is actually what the safety and health practitioners use in the workplace in trying to control hazards. No? What are the hazards in the workplace? We have the physical hazards, the biological, chemical, and also all the ergonomic hazards present in the workplace. Um, but here, if you can see, as you can see, that for the elimination and substitution, we don't have any entries. No? Kasi po, not all workplaces are uh, actually handling or wala po talagang naturally occurring or present na COVID. No? So it's only assumed that dun sa ating mga workplaces in general, they are germ-free and COVID-free, except for health facilities, wherein handling of COVID patients and that disease is really part of their work process. So, but then again, since we don't have any cure yet as of now for SARS-CoV-2, which is the causative agent for COVID-19, so we cannot eliminate. And at the same time, we cannot use the principle of substitution. So, kasi wala naman po talagang ganun na that we will substitute all biological hazards or biological hazards, we cannot substitute one for the other. But for elimination, since we don't have a cure, we cannot eliminate, and we don't have vaccine yet as of this time, so we cannot eliminate. So what we are trying to implement in the workplace are these three, no? Yung engineering controls, administrative controls, and the use of personal protective equipment. But for engineering and the use of engineering control and the use of personal protective equipment, I think we have already maximized. No? Kasi we try to isolate and try to put barriers. So that's the engineering controls, and we already have in our minimum public health standards the use of face masks and face shields. And for health facilities and for healthcare workers, use of other PPEs like coverall, gloves, so such those PPEs. No? But what I can really or I wanted to focus more is the use of administrative controls. Sa that since parang ito po yung isang aspect that we have not maximized yet as of this time. That if we maximize the implementation of administrative controls, then we can have a greater chance of preventing and controlling the spread of COVID-19 in the workplace. So as I've mentioned a while ago that we have all these existing operational frameworks in the workplaces. So we have the National Action Plan now, which is we are now at the phase 3, and it is more of geared towards recovery, both phase 2 and phase 3. We have the containment strategy and the PDITR strategy. So for this operational framework, we will be using a combination of some of these strategies. So as I've mentioned a while ago also that this operational framework was really envisioned to be a one operational framework for workplaces. But as the discussion went from starting August, it's really very difficult to have one operational framework for workplaces uh, because basically in general, no, workplaces are really unique on its own. No? So uh, there are peculiarities in some workplaces that meron sila and then other workplaces doesn't have. So very unique ang workplace mo for all, actually for all type of workplaces, even on the same categories. No? Magkakaiba pa rin po sila. And then also, as the discussion went, no, when we discussed this operational framework, in order for not to cause any confusion on the part of the private sector industry, that naglabas na po kasi ang Department of Trade and Industry and Department of Labor ng kanilang guidelines, and there has been an issuance of a supplemental guideline. So as not to put strain on the on the private sector, so it was agreed upon during the last meeting that this will be an operational framework for the public sector workplaces. It will be a joint memorandum circular between DH, CSC, and the National Task Force. But then again, for the purpose nga po of discussion for this day, all the things that will be mentioned here, including the principles, are actually can be applied to all workplaces. So regardless of kung if we categorize them into large, medium, small, or micro establishment, or if we categorize this as public sector workplace, principles that were mentioned here are actually applicable for all types of workplaces. Even if yung mga micro enterprise, so pwedeng gumawa po ng on their level ng kanilang sariling plans. Ang nakikita ko lang po dito that would be a hindrance for the public sector is that some of the things that are mentioned here requires budget that we were not really prepared for. Kasi nobody was ever prepared or nobody knew that a pandemic would ensue. No? So for our work plans for 2020, hindi po tayo nakapagbigay ng mga funding for this. But since na at this time we still don't know where this would go no or for next year kung magkakaroon po ba talaga ng vaccine. So probably ang best ano po dyan is to put funding. This is for the public sector no, but to put funding uh, for the 2021 work plan. And then also difficulty with for the public sector is that ano po ba yung mga things that i-allow po ng COA or DBM na lagyan po ng fund. So because not all would be allowed no or allowable under the COA or DBM accounting rules and regulations. So what are the guiding principles for the framework is that COVID-19 response is a national government enabled, locally led, people-centered, and there has to be a balance of health and economy. Because as I've mentioned that many of our industries were affected and that now we should gear towards recovery. And how can we recover? We have to open up little by little our economy. So we have to be prepared in the workplace regarding the transmission of COVID-19. Localized response to improve participation of community and stakeholders and to increase the support for the people and advocate ownership for stakeholders. So when we talk about the workplace, yung mga stakeholder po natin dito, ang mga primary players po natin dito are the management, the employees, and our clients. So these personalities are the main players in the workplace. To establish and sustain a strong private and public partnership, as this will be seen later, no? How we can establish and sustain, or why we need to have that strong private and public partnership, and then ensure business continuity amidst COVID-19. So because now at the phase three, so we are geared towards recovery. So these are the principles that are incorporated in this unified operational framework. So actually, we'll be implementing the PDIP or strategy or the prevent, detect, isolate, treat, and recovery strategy for this. No? So under the prevent and under all of these components, we have the subcomponents. So for the prevent, we have the workplace systems, policies, workplace safety standards, engagement, workplace coordinated operations. So under the detect, we have the active and passive surveillance, contact tracing, targeted and expanded testing. For the isolate or quarantine, we have the offline kalinga, triaging, and referral to the proper appropriate facilities. Localized lockdown, which is actually it's not really controversial, but there's been so many questions on the localized lockdown. And the treat, the one hospital command, still have benefits and the recovery. So stigma on the mental health of all those who were affected, social protection, and the integration. So actually, when we talk about occupational health, nandito po lang po tayo actually sa prevent. So principles that are being applied sa occupational health will all be on the prevent. But for the detect, isolate, treat, and recovery, we will be applying the principles in management or the ones that were actually set, the standard set by our infectious disease specialists, microbiology specialists, and of course the program sa emerging and emerging infectious disease for COVID-19 is under. So actually, I'm not really an infectious disease specialist. I am an occupational medicine, occupational health practitioner. So much of the information that I have is on the prevent, but we will just be following standards for the detect until the recovery. So these are the subcomponents of the prevent. So as I've mentioned a while ago, so we have the building workplace systems capacities, ensuring workplace safety and risk communication, and workplace code team. So for each subcomponent, meron din po tayong mga other subcomponents din that we will be uh, discussing as we go along. So for the established workplace risk reduction system, these are the principles that I think that every workplace should do, implement, or should have knowledge of. So if ever that you are now operating, or for those industries that will still be operating as we open up the economy, these are the things na kailangan po natin gawin. No? So we have, actually we can provide the uh, regional office ng CHC Caraga with the uh, attachments for this presentation. No? Kasi we don't have much time to discuss everything, but in principle, these are the things that must be done by the workplaces, the industry, or the establishment when they open up, and then now that they are operating. This is what they should do. So they should do a workplace risk assessment. Because we are the UH, we're using the WHO classification. No? Now we have to classify our establishment as to high, very high, moderate, or low risk. When we say high or very high, ito po yung mga industries natin that really uh, that COVID-19 or SARS-CoV is part of the work process, like the health facilities. So the health facilities is actually automatically nasa high and very high risk kasi nga all patients, whether confirmed or suspect, are going there. So they are all the workers, the healthcare workers that are inside that facility are at risk of contracting SARS-CoV-2. And then for those moderate risk, so these are workplaces other than health facilities or other than establishments handling COVID. So what are these? No? So actually, a lot or almost all of the workplace are actually at the moderate and low risk, except if you're really handling, part ng process niyo yung pag-handle ng COVID-19 or ng SARS-CoV-2. So mga laboratories and health facilities. But for the moderate, these are all other offices. So when you are classified as moderate, so these are establishments, facilities, or workplaces that are actually in contact with clients. No? So they have clients going there, or they are as attending to clients. So kinakausap yung clients, bumibili yung kliyente, pumupunta yung kliyente mismo dun sa kanilang establishment. Also, if you are a moderate risk, each establishment should know kung saan po nakatira yung kanilang mga employees. No? If their employees are coming from areas with a high incidence or with a high transmission of COVID-19, then at least din po yung workplace na yun. So pwede ang magdala po ng COVID-19 sa workplace is yung employee na nagagaling po sa mga areas kung saan sila nakatira. Wherein there is a high incidence of transmission or high incidence of COVID-19. These are classified as example of classification as moderate. If you are at the high and moderate, then alam nyo na po no, that you have to prepare more para hindi po mag-transmit ang SARS-CoV-2 or COVID-19 sa workplace. Ang low-risk establishment po, these are establishments or offices or workplaces wherein pumapasok lang po yung mga employees that they don't have any contact or wala pong clients na pumapasok. So these are offices na the usual typical office space that walang clients. But then again, you can be classified as a moderate risk if almost all of your employees are coming from places where there are high incidence of COVID-19. So yun po yung paraan how you will assess your workplace according to risk of transmission or having COVID-19 inside. No? So ito po yung based on the WHO classification. And also, ito po yung isa dapat gawin din ng establishment or ng workplace yung exposure risk assessment. So they have to identify sa kanilang workplaces yung mga choke points or yung areas wherein there are high risk for transmission. So ano po yun? Yung example po, yung entrance and exit, kasi po dyan pumapasok lahat. No? Clients and employees alike. Small and confined spaces, like elevators, no? Space with limited ventilation, restrooms, frequently ano no na frequently na pinupuntahan po ng mga employees, so frequented areas, pantries and dining areas, hallways, and if the establishment is providing shuttle services for their employees, it can also be a choke point of area of high transmission. And then for those providing dormitories and accommodation, this can also be a high risk area. And then for those employees who are availing of public transportation, then these are also avenues for contracting COVID-19. So, and then COVID-19 risk management and control measures. So, yung mga nabanggit nating mga control measures kanina a while ago, engineering, administrative, and use of personal protective equipment and other logistics, and COVID-19 risk communication. So, na-mention ko po a while ago that kahit po yung mga micro-enterprise actually can implement this, no? Can maturuan lang sila. So, can be capacitated on doing these things. And if you're watching the news, nakikita po natin sa kagustuhan din naman ng ibang mga kababayan natin belonging to the small and micro enterprise. Actually, they have prepared. Kaya lang, ang ano po doon, the thought is that they should prepare not only for the clients but also for their employees. So two-way po no ang protection, protecting yourself and protecting the clients. But yun nga po, these principles actually can be applied to any type of workplace. So yun nga lang, may mga challenges, may mga sarili-sarili kasing peculiarities, should I say, no? Especially ang public sector workplace is also a very peculiar workplace. No? So each has its own characteristic, no? That is unique. So everything here is not prescriptive, but we encourage and actually uh, these are suggested. So for every establishment, kailangan po meron silang occupational health and safety plan. So even the micro enterprise actually can have their micro plan. So what does this plan contain? No? So meron dapat plan for infection prevention and control. Merong crisis management, so including plans on handling asymptomatic employees. For example, sa isang sari-sari store, kung hindi naman kamag-anak nung may-ari ng store yung kanyang empleyado, so umuuwi or pinapatulog, pinapastay sa ano po yung plan nila in handling the symptomatic employees. So, kailangan meron silang plano on that para hindi mahawa yung everybody else na working dun sa ano yun, sa sari-sari store. So, if the owner cannot provide, at least facilitate. Yun lang po yung minimum requirements na hinihingi natin. If the employer cannot provide these things for free dun sa employee nila, at least they should facilitate. So yun po yung ating at the minimum. So for the bigger industries, kailangan meron silang business continuity plan, isolation and evacuation plan, surveillance and contact tracing plan, testing, referral and monitoring plan, risk communication plan, capacity building contingency plan. Sa dinami-dami po, no? So actually, ang nilalaman lang nito is basic what to do in case of. So pag nagtanong yung empleyado nyo, ano po gagawin namin, ma'am, sir? Ganito po, ganito, na-expose kami, meron kaming nakasalamuhan na positive. At least yung mga questions na yung masasagutin, ano yung gagawin? Ano yung basic na gagawin? So, it's not really a very complicated plan, but just having this plan na ma-address yung mga basic things is actually okay. So, pero dapat ito lahat meron. And actually, on the prevent aspect, this framework can be used not only for COVID-19 pandemic, so for any other type of pandemic, biological hazard. So, dun sa prevent aspect, we can actually use this not only for COVID-19. So, nagkakaiba lang the strategy and what type of, let's say, klaseng pandemic or biologic hazard in the future. So, mag-iiba po ang management. But for the dun sa components po ng TBITR or the prevent aspect, ito po yung mga things that we can do not not really directed for COVID-19 alone, but can be used for other type of pandemic. So if you have this plan on hand, so you can say that meron po kayong you are now ready to operate again. If your plan can address those questions, what if may nagkaroon ng symptom, what if may nagkaroon ng positive case, ano yung gagawin natin. So, if you have this, you can say that you are ready to operate under the circumstance of having a pandemic or yung community transmission of SARS-CoV-2. So, this is the ideal composition ng OSH committee for COVID-19. But then again, as I've mentioned, that each workplace is unique in itself. So, the only people that can say what will work for them are the management, the employee, and the designated people for safety officer or surveillance officer na designate. So these are not really saying that you are prescribing this, but you can adapt or you can improve this. So basta the most important thing for the composition of the occupational safety and health committee is that everybody is uh, represented from the management to the employees. So yun lang po yung take home information or ano po na naisasabi ko. While we have this chairperson, members, and secretary, but everybody should be represented. And then that actually, not only the composition, but the establishment, as much as they can, for the large or medium, or kahit yung small, if they can organize their occupational safety and health committee, the better. So these are also the functions of the OSH committee for COVID-19. So they are the ones actually developing the plans ng budget natin kanina, the programs, and the contingency measure on the prevention and control of COVID-19 directly. And then they do not only develop the plan, but they also implement it and monitor it according to the plan, do, check, and act cycle. So plan, you have these plans, you now implement it. You have to check, you have to look back at your plan. For example, if you have a very comprehensive plan, but still you're having an increased transmission or tumataas po yung cases in the workplace, you have to go back to that plan. Baka ano ba yung nagiging sanhi ng bakit tumataas pa in spite of that you have this comprehensive plan. And then if you have already if you evaluated that plan, you have to make another one and react on it. So it's just a cycle. No? So you have to monitor your plans. Ano ba din sa implementation that it's going wrong, bakit tumataas pa rin ang cases. And then this committee shall initiate trainings for the workers, policies on the work arrangements. And actually, important to initiate a training is for the infection prevention and control. So, very simple lang actually yung ating mga pinapatupad na minimum health, public health standards on PPEs, pag-wear ng face mask and face shield. But, are they doing it right? Are they doing it correctly? So, they should train their workers on the proper donning and doffing of the PPE, but not only on the donning and doffing, pagsuot at paghubad, but also on the disposal. So para po, when they go to their respective community, sa bahay po nila, alam din nila kung paano gagawin. So, kasi right now, we are actually having problems in disposal of some of the potentially infectious diseases as a result of this pandemic. So as not to add on that problem, so kailangan natin turuan yung mga workers natin on the proper disposal of PPEs. So also, if you are going to designate safety officers or surveillance officers in the workplace, you have to train them on the on how to do their designated jobs. Like if they're assigned as a surveillance officer, should provide them training. So if you cannot provide them training, you can actually ask some institutions or can actually ask the government for the training that required or kailangan. So, a training on surveillance, isolation, evacuation procedures, testing and referral procedures. Na-mention po kanina that basically, when your employee asks, ano po ang gagawin namin? What to do in case of? Kailangan po masasagot yun. So, yun po yung kahalagahan ng training. And also, the Health and Safety Committee facilitates forging of networks. Ito po yung kanina na-mention ko that we have to establish that private and public partnership. Kasi po right now, the avenue for the government uh, to provide those services and for us to be able to report cases is through the local government unit. So they have to be engaged, no? Especially yung ating mga BHERTs, yung Barangay Health Emergency Response Team, yung ating mga local, city, or municipal epidemiology and surveillance unit for the reporting of cases. Kasi po, the COVID-19 is also part of the reportable diseases no, under Republic Act 11332. Oh, and then also, as I've mentioned, that if the employer cannot provide to their employees, yung let's say, where they should be treated or where should be brought in case of they have contracted the disease, dun po tayo lalapit sa local government unit for the temporary treatment and monitoring facility or yung mga mega testing and treatment facility natin or to the nearest health facility. So at least if you cannot provide, you have to facilitate yung, yung proper disposition for the employees kung saan po sila dadalhin at saan sila iti-treat or iti-test. So having said yun po, no, so kanina we talk about the training. So these are the possible training providers. No? If you cannot provide these trainings in your workplace, then you can ask naman, call a friend or ask institutions or especially the government for those trainings. So ito po yung mga na pwedeng mag-provide. So we should always start paganahin po natin yung ating yung system, no? So, should ask our local government unit first. If not, i-refer din naman nila kayo sa sa ibang units for your needs, no? Especially training needs. So, for the ensuring workplace safety, so we have these subcomponents in implementing the minimum public health standards, safe workplace area, safe transportation, safe time, safe accommodation. So for the slides that I will be showing from the next slide and to several slides after, those are things that we think are important, but actually it's not really that prescriptive. No? That those things that will be mentioned can be applied, can be improved, and can be added on. No? Kasi na-mention ko po that every workplace is unique. And then the only people that can say what works for them are the management, the employees, and the clients of that workplace. So, yun pong makikita natin. And then, ipapakita po natin sa illustration of ano po yung mga roles and responsibilities that the employees and the employers and the safety officers or the surveillance officers have, no? So these are more of their responsibility, but they are not prescriptive that could be adapted and it can be improved. So for the minimum public health standards on the part of the employer, ito po yung mga things that are important. No? They can provide disinfectant and washing resources such as hand washing stations, soap and sanitizers, and these things to their employees. No? So since you are the employer, kayo po yung may not actually your sole responsibility, but at least you have nasa pwesto po kayo to provide these resources, no? Like yung markings and signages on the floors for employees to practice physical distancing, mag-provide po ng mga signages and visual cues, and reminders to practice hygienic behaviors. And then also, kayo po yung nasa inyo po yung level to allow your employees for an alternative work arrangement. So, isa po yan sa mga napo-perceive namin that responsibility, if not something that I have to do. No? Provide employees with psychosocial support and promote work-life balance. So yung mental health and psychosocial support po is not actually only for the recovery or the integration, but all throughout, kailangan po provide natin yun sa ating mga employees. So a simple way lang po of providing psychosocial support is by uh, checking up on them once, at least once in a while. So just sending SMS, email, or message, calling them, asking them ano na ang kalagayan nila, and then reminding them to be safe. So those are small, simple things to do that can show our psychological. So provide PPEs like face masks, face shields, and hand disinfectant. So again, as I've mentioned, if you cannot provide, at least facilitate for them to be able to, for the employees to be able to access these things. So for the employee naman, what they have to do is to follow the office policies, no? Observe the minimum public health standards set, the hygiene practices that are set, or the policies. No? Usually, this will come in form of policy pag nasa big companies tayo. So, if they have issued these policies, also in the in the government offices, also if they have issued such policies, kailangan gawin ng is to comply. But before issuing those policies, actually, kailangan na-consult po yung ating mga empleyado. So they have to be well informed, and they are consulted, and they are part of the decision making. So for all policies that will be implemented, especially yung mga health programs and policies natin, kailangan po well-informed ang ating mga empleyado, and they are consulted, and they are part of the decision making. No? So yan. And then they should follow, going back, no? They should follow this minimum public health standard, like yung practicing of respiratory hygiene, yung avoid sharing of personal items with co-employees. And also, if they are if they belong to the most at risk population, or if they have been suspected of having, or they have been exposed, if they are asked uh, to be put on a work from home arrangement, you should comply naman po. And then wearing of personal protective equipment at office premises if needed. No? As long as hindi po siya sagabal sa work process na ginagawa within the workstation. So there are several especially sa mga manufacturing wherein nakaka-istorbo po yung pagsusuot ng face mask and face shield. No? So pwede pong gawin yun, but still you should always follow the other minimum public health standards set. As for the safety officers, sila po yung kasama po ng ating Occupational Safety and Health Committee na mag-implement ng mga minimum public health standards. They are designated as such to provide reminders for the employees to follow the minimum public health standards. And then they can direct the movement of the traffic if you have set a policy for the unidirectional flow sa office, to determine number of employees allowed to stay at any given time in a common area, and to remind employees to follow the minimum public health standards. So if you will notice that for every subcomponents, medyo nauulit lang po, no? But because these are things that kailangan gawin. So it's not actually being redundant on these things, but these are the things that has to be done. It have to be done. So for the safe workplace area for the employer, so they should provide resources for these things, no? Installation of adequate and appropriate ventilation. Actually, we are advocating for a natural exchange of air, no? Hindi yung recirculated air. So may danger po dun sa recirculated air. So as much as possible, we should facilitate natural airflow exchange in the workplace. So what are the things to do? Opening of windows, opening doors, turning off yung AC unit, to reduce air recirculation, or replace units with may air exchange, no? O yung may mga tinatawag nating high efficiency particulate air filters, yung HEPA filter. But we are not really recommending the use of HEPA filters na baka mamaya we just mentioned that this can be used. So, but we are really not advocating for the use, but this can be used as part of yung control measures. No? And then rearranging and redecorating of public places or areas in the workplace that are common areas, no, of convergence. So these are activities for the employer. And then they can provide place for with appropriate physical barriers between, if they are as I've mentioned kanina, if you are an establishment handling or dealing with customers, so you can put these physical barriers as a form of engineering control. So, and actually a lot of these things mentioned here are, if ever that the workplace has actually the committee and the policies in place, so ito po yung mga laman nun. And then these are the responsibilities under those policies that are being implemented. So as I mentioned kanina, the employer should engage employees on matters concerning their health and safety, including decision making. So every policy in the workplace or program, kailangan pong ma-communicate well with the employees, and they should be involved in the decision making, and then they should be properly informed. So the employer also should provide employees with information on workplace entitlements, such as if they have been issued or they were allowed to work from home, or to to isolate or quarantine themselves. So ano po yung mga entitlements nila? So mababawasan po ba yung leave nila or hindi? If may issue po on that, then the human resource office can always consult the employees on these things. No? Ano yung magiging agreement nila on these things. So again, for the employer, they should allocate budget for COVID-19 plans and programs. So for the government naman, that we're really not prepared na every year kasi gumagawa po tayo ng work and financial plan, that for this 2020 talaga, nobody ever nobody ever knew that this would happen. So hindi tayo nakapag-allocate ng budget. Now for 2021, since we don't know that kung kailan po or when this pandemic would end, or until wala such time that we have vaccines, no, we can still plan and allocate budget for 2021, uh, uh, addressing COVID-19 in the workplace. So again, yung allow for alternative work arrangements, ensure availability of technology. So now the new normal is conducting meetings through online platforms or video conferencing. So they should ensure availability if talagang kailangan po ng mga employees. And then limit face-to-face na as much as possible yung meetings natin. We should restrict mass gatherings of employees, and they should provide PPE, disinfectant supplies, and other logistics. For the employee naman, again, your responsibility would be initiative to be familiar with policies in the work arrangements. So, as I've mentioned a while ago, uh, whatever policy or program that will be implemented by the management, you have to have that initiative to be familiar with it. Or if ever na hindi po kayo kinonsult, you should have to be proactive, and you have to ask the management, ano po ba yung mga policies na in-implement nyo regarding COVID-19 or related to COVID-19? And then take part in the training programs if provide po ang ating mga employers ng training programs and information dissemination, they should take part in these activities. Strictly practice personal hygiene and avoid mass gathering or crowded areas. So, as much as possible, you should prefer the use of platforms that restrict yung face-to-face meetings. No? So, like yung mga video conferencing. So, avoid common areas and then disinfect your workstation as frequently as possible, although ang recommended is twice a day, but you can disinfect as much as you can, as much as you would want to disinfect your workplace. And then always follow the minimum public health standards wearing yung mga PPEs. Except if those PPEs are hindrance to the performance of your task. So for the safe transportation, since hindi pa po 100% nag-ooperate ng public transport natin, since a lot of the employees are also using public transport, so while we are still under the danger of uh, SARS-CoV-2 transmission no, in the community. So if the employers can, they must they are encouraged to provide vehicles no, for their employees. And then in that vehicles, they should provide the same thing, yung mga hand disinfectants, implement the minimum public health standards, and then implement yung mga policies such as no eating, no talking, no taking of phone calls, and then those who can, no, they are encouraged to provide shuttle services. For the driver or dispatcher naman of those shuttle services that we're providing. So sila po yung gagawa nito. Screen all the passengers for symptoms. Example, pag implement ng temperature check. And then if ever na merong symptoms or fever, then they should be referred accordingly by the driver or dispatcher. And then they should practice opening of windows. Unless meron pong HEPA filter. We're not really actually, again, I will be mentioning it, we're not really promoting HEPA filters. But ito kasi yung one of the things that can be done to prevent uh, those microorganisms or virus to be recirculated inside. But hindi naman namin pinopromote that the the vehicle should have this one. If not, yeah, just open the windows if possible. And then frequently disinfect objects or areas frequently touched by the passengers, like yung mga handles and rails. So disinfect as soon as the seat is vacated or for every trip completed. So again, a trip manifesto is actually encouraged, just like in sa mga airlines natin, so that we can easily follow them up or to facilitate contact tracing, and then no picking up of other passengers along the route. So just drop off the passengers at the designated drop-off points. So help passengers find their assigned seats. Ensure that passengers are complying with the minimum public health standards. They can reprimand actually non-compliant passengers. Ensure that all passengers are wearing face masks and face shields. And then provide masks or face shields if they need one. And then for the employee naman, riding these shuttle services provided by the employer, so they should observe, again, the minimum public health standards, the queuing, and then comply with filling out of the manifesto, wear PPEs, practice personal hygiene, so avoid talking, eating, and taking calls. Kasi these are the activities that generates aerosols, no? Or yung tinatawag natin. Since now that I don't, that they have acceded that SARS-CoV-2 is also a airborne, so we should avoid these aerosol generating procedures. It's the merely talking, shouting, and singing. They are aerosol generating procedures. And then avoid touching commonly touched surfaces. So should have it in yourself. Yung safety, yung say yung culture, should develop in yourself yung culture of safety. And then, after arriving sa home, sa mga bahay, you should take a shower immediately and put the clothes sa laundry bin or wash them. And then never use any clothing na ginamit outside. So if you're riding the public transportation for the employees, so determine the safest and shortest route to work with the least number of changes of vehicles. Avoid unnecessary trips to other public areas except when really necessary. No? So what are those places? Yung markets, malls, on your way to work, on your way home. So only uh, go to these places if really necessary. And then if possible, instead of taking public transport, you can use bicycle, can ride your own bicycle or you walk. If possible lang naman po. And then observe physical distancing when queuing and kasi makakasalamuhan niyo po sa public transport yung iba't ibang tao coming from all places. No? So you have to be extra careful. And then practice personal hygiene. And then again, just to reiterate, for your protection and for others protection of others, so you avoid the aerosol generating procedures like talking, shouting, singing, or taking calls. Just take time to be quiet and yun po. And then avoid touching commonly touched surfaces for your protection. And then again, upon arriving home, take a shower and put your clothes to the laundry bin if you will not be washing them or wash them immediately. And then wear PPE. And then for the safe dining, so these are the activities for the employer. So allow use of canteens. However, they may set up additional makeshift dining areas to complement their existing canteens sa workplaces. So baka maliit yung canteen, it can set up an additional makeshift dining area. And then implement again the minimum public health standards by placing markers to remind the employees, and then implement these policies like yung alternate table arrangements. This allow eating at both opposite sides of the table, and then provide markers again. Encourage to provide individual packed food items for each employee. So you can actually apply this only limit the duration of employees dining in the dining area. And if you can, encourage lang naman po, but not necessarily sabihin na these are prescriptive. If you can distribute meals individually for employees para hindi na po sila lalabas o bibili. But only if the employers can. If not, facilitate na lang po. And then prohibit the use of communal items such as yung mga dipping sauces uh, or and encourage other employees to use their own utensils, bring their own spoon and fork pala, enforce staggered meal schedules, limiting the number of employees in the dining areas, prohibit buffet meals or other similar setups, and ensure that food handlers are screened. No? So there are uh, service providers sa canteen ng mga establishments or offices. No? And they have their own food handlers. So that the employer must ensure that those food handlers are screened also and monitored regularly. And then for the employees again, they are encouraged to bring their own food to work and eat alone if possible sa workstation mo. And then practice personal hygiene prior to eating. Again, encourage to use own utensils. Avoid unnecessary talking while dining. Limit lang yung time to less than 15 minutes if you can. And then after dining, clean and wash your own utensils and food containers, and then taking only your PPE when you are ready to eat, and then placing them on the top of the table on the napkin. And then for the safety officers, they should monitor if they are implementing in the directional flow of traffic, and then regulate the number of individuals entering the dining area, and then ensure the minimum health standards are practiced at all times, and then ensure that employees are seated as soon as possible. So actually, the safety officers will be the one responsible to implement the minimum public health standards. not only in the whole workplace but at specific locations inside the workplace. So, with for those employers, providing accommodation, so we are now on the safe accommodation. For the employers, they are encouraged to provide accommodation either on the site or near site, no? Malapit lang din sa workplace to avoid risk exposure during commute or transit to and from residence and workplace. So especially for those employees residing far from the workplace, no? They are encouraged na naman. But if the employer cannot provide this one, please facilitate na lang po. To ensure that accommodation provided comply with ventilation standards. So meron po tayong ventilation department memo on ventilation. It was issued by the Health Promotion Communication Service. And then again, for the ventilation, adequate air exchange is actually preferred more than the recirculated air. So if possible, provide a single room accommodation. But if not, should measure the floor area so the number of person that can be accommodated in that room. Para po meron ma-observe din natin yung minimum public health standard of physical distancing. And then in the accommodation, they should provide signages and reminders on the practice of minimum public health standards, practice of personal hygiene, and respiratory etiquette or hygiene. And then screen all employees prior to the stay in accommodation provided. May apply the rotational schedule 14 days in, 14 days out. So yung 14 days in, this means that, for example, we can use this work process na for 14 days, papasok yung employee, and then for 14 days, they would be staying at their residence or at their accommodation and observe themselves if they will be developing symptoms. So this is actually a work arrangement, an alternative work arrangement. And then they may provide necessities such as food and personal supplies. They're just encouraged, but they are not really being mandated or it's not mandatory if they can. But if not, please facilitate. So as yung mga employees natin will not be going to the public areas where a lot of people are converging. And then encourage employees to stay at home or the residence or the accommodation unless it is extremely necessary for them to go out. And then ensure sanitation standards are implemented in that accommodation, especially if with communal restroom, and encourage employees to clean the restroom after each use. So flush the toilet with the lid closed. And then for employees living in company-provided accommodation, ito po yung kanilang mga kailangan gawin. So again, they have to comply with the policies being implemented by the management or the workplace. Especially yung standards imposed by the Occupational Health and Safety Committee. And then check for the ventilation, if they are if the air is being recirculated, and open the windows para for a better air exchange. Practice personal hygiene, and then immediately proceed to residence after work. Do not stop at public areas. So again, we are just reiterating yung policies that will be implemented by the management. So actually, we're just repeating, but these are the things that are uh, the must do of the employees na living in that accommodation. So if they are renting, so same din lang naman po. If they are renting or staying in a place not provided by the employers. So again, kailangan nila mag-comply din sa public health standards being implemented by the OHS committee. So all the policies that are being implemented by the management and the Occupational Health and Safety Committee should be actually followed by the employees. So kaya po important kanina, as I've mentioned, that we have to inform the employees regarding these policies, and we have to include them in the decision-making process. And then make sure that these are well communicated. So if kulang po yung by just issuing policies or posting policies, kailangan po if better if makapagsagawa po ng training yung ating mga employers for the employees para po to make sure that they would be complying with the policies and programs. And then for the dormitory manager, meron din po silang responsibility, especially contracted output. So this accommodation should comply with the minimum public health standards set by the DHBPI and DOLE. Kasi po, by themselves, yung mga dormitories and mga ano po, rented or accommodations are also workplace no, by themselves. No? Isa din po silang establishment na matutukoy natin. So they should comply with the DH requirements under PDA titles regarding yung mga regulatory requirements nila under the city and municipality. So they must secure a valid and updated license to operate from the city or municipality. So they must have an operational plan to protect not only their tenants but also their workers from contracting COVID-19. So as I've mentioned kasi, these dormitories or accommodations are actually workplace themselves or actually another establishment if you would look at it that way. So they should implement sanitation and disinfection measures, and they should set decorum on the use of communal spaces to prevent mass gatherings and ensure hygienic use of restrooms and common areas. So on the disinfection in workplaces, actually, I'm also not an expert on disinfection in ano po, but the Department of Health has issued. Actually, this is based on the issuance of the Department of Health regarding disinfection of workplaces. So the most common products that we use for disinfection are actually chlorine-based products and alcohol-based products. So these are their applicable use and recommendation on the preparation. So actually, all of these are also provided in that issuance. So chlorine solutions must be freshly prepared every day. Thoroughly clean surfaces first with soap and water before using the hypochlorite solution, and then dilute hypochlorite solution with non-sorbent water. One thing that we should remember that these disinfectants are also actually hazards uh, for the person. No? These are all actually hazardous or poisonous. No? So proper use and proper preparation should be done. So wag po natin kakalimutan yung that if we are using this to prevent the transmission of SARS-CoV-2, we should also bear in mind always that these are also things that can harm us. So these disinfectants are also chemicals, and these are hazards and dangerous to the health. So they should be prepared and used properly. So these are the recommended frequency of cleaning of environmental surfaces. So yung screening areas at points of entry at least twice daily. The workstation, as I've mentioned a while ago, that this is recommended twice daily, but the worker can actually disinfect as much as you want to. How many times in a day you want? 10 times or 12 times. That's as often as you want and as often as you can. So for the whole office or the of building, so after every shift, it is recommended the hallways and corridors at least twice daily. And the bathrooms and toilets, especially yung shared toilets at least 3 times daily. So medyo magiging busy po ang ating mga utility workers. And then disinfection methods not recommended are spraying and fogging. Spraying directly on the person na hindi po nakasuot ng coverall, and yung fumigation or misting. And also, yung use po ng UV light radiation na wala pa po tayong masyadong basis or we still need further studies on this. Although ako po as a biologist, I know that ultraviolet light causes mutation din sa ating genes. No? And especially if the SARS-CoV-2 virus is just an RNA, this UV light radiation can cause mutation. No? So it can stop actually the replication. But then again, if we are going to use this for the as a precaution measure for the safety measures for the public spaces or the workplaces, so wala po tayo masyadong evidences and it needs further study. Again, for the disinfection of workplaces, for the cleaner naman po or the utility worker, ito po yung mga responsibilities nila. So, they should use FDA-approved household disinfectants and follow the instructions on the label, ensure adequate ventilation when cleaning, and then separate the cleaning equipments used in company cleaning or workplace isolation areas. As much as they can, color code cleaning equipment if possible. Use water at room temperature for dilution. Wear appropriate PPE. Of course, if you don't know if meron pong virus that nandun sa mga services, so should protect themselves by wearing of mask and gloves. And then skin protection and eye protection naman for because they are using chemicals. No? And these are also hazardous. They should protect themselves not only from the virus but also from the hazards of the cleaning agents. Clean from the least soiled to the most soiled areas, from higher to lower levels in a systematic manner. Again, leave the solution on the surface at least 1 minute. Use fresh cloths at the start of each cleaning session. Discard detergent or disinfectants after each use. So, these are all chemicals. So, meron po yung mga instructions on the proper disposal. And then, wash and clean buckets with detergent. Rinse, dried, and stored inverted to. Drain fully after each use. Disinfect every 4 hours highly touched surfaces. Yun po ang ating recommendation. Recommended lang naman po yun. But they can also do better or they can tone down. Disinfect the whole workplace every after work shift. Recommended din po. And ensure that cleaning equipments are well maintained. For the disinfection team, so close off areas used or visited by the suspect probable. So, ito po yung actually meron pong issue on the lockdowns. No? Kasi po regarding the disinfection of the workplace, actually pwede naman pong hindi i-maximize yung 24 hours no? Before resuming resumption of work. Kasi meron naman po tayong mga disinfecting agents that can be applied, can be used that even after 8 hours or immediately after ma-disinfect, pwede na pong gamitin yung ating mga workplace. So, we need not maximize the 24 hours. So, yun po yung actually na napag-usapan even with the meeting sa sub-technical working group on workplaces. Kasama po din ang DTI, DOLE, UH, CSC, and the National Task Force. No? So, it was agreed that depende po. No? So, for the list of cleaning materials that are allowed or registered, you can always visit po yung website po ng, or you can consult Food and Drug Administration po. And then, again, for going back, no, for the disinfection team, they should open doors, allow air circulation while they are cleaning the area. And then, they should wear the proper PPEs, no? Not only complete, but the proper PPEs. And then, temporarily turn off the air condition and or the HVAC, no, to avoid contamination, and then clean and disinfect all areas by the suspect probable or confirmed COVID-19 case with 0.5% chlorine solution. Again, this is a recommendation. No? And then vacuum the space if needed, and use a vacuum equipped with high efficiency particulate air filter. So we're again, I'm saying that we are really not promoting or recommending. No? These are just yes, recommendations actually, but we are not promoting. We are recommending kasi this is one of the things that can be used para po to prevent or to filter out yung mga particulate matter, including yung mga biological agents or biological hazards like viruses. No? And then may open areas to employees immediately or a few hours after the disinfection. So ito po yung sinasabi natin that dun po sa policy issuance that kailangan po after 24 hours before resumption or opening of the workplace or the office. So we need not maximize the 24 hours. If ang concern po ng ating mga establishments is to operate immediately. Kasi po, every minute, every hour counts for these offices or these workplaces, especially yung mga manufacturing, yung mga business related na workplaces. Every time counts for them and every personnel counts. No? So yun po yung mga actually issues ng mga, especially yung mga private companies natin, no? Yung mga manufacturing, that hindi po sila makaka-operate, hindi sila makakapag-produce, hindi sila magiging productive if half or if not all of their personnel are working from home or not allowed to work, or if the workplace is being shut down for 24 hours or more. Especially if you need, if they need clearance from the local government unit. So actually, we are now promoting that every workplace can uh, decide to operate basta as long as nasunod po yung minimum public health standards on disinfection and sanitation. No? So as I've mentioned, there are cleaning agents that can be used para po the establishment can operate again after the disinfection. And then clean surfaces, again, na-repeat lang po natin for the employees, no, who are disinfecting their own workplaces. No? These are the things to do. You can disinfect with soap and water, you can use alcohol, and then practice routine cleaning as often as you want. Um, then disinfect your workplace at the start and end of every shift, and wear proper personal protective equipment. So, for the workplace code team, ito po yung ating, if you will remember, meron po tayong code team sa community. We can also actually implement this code sa workplace, no? But in the code for workplace, we also have to include or engage the local government unit. So, you engage the city or municipal health officer in the LGU where the establishment is located, and then assistant lead is the workplace head, and members are the relevant workplace personnel. So the workflow po, the process would be the code team shall assess the workplace for compliance to protocols pertaining to PDITR strategy, and then the code team shall mobilize the workplace and stakeholders for action planning, assisted by the implementation of the plan by providing technical assistance and complementing the workplace resources if needed. And mag-end lang, this, ano nga pala, no, if you have cases or rising cases no, sa workplace, you can activate the code team for the workplace. So, ito po yung mga gagawin. No? So, also using the plan, do, check, and act. No? So, may plan yung establishment that we will evaluate and we will assess that plan if we go work and what are in those plans na hindi ba nasusunod or what went wrong. And then it will be acted upon by the code team, and technical assistance will be provided by the code team, no, from the relevant personnel, no, the LGU and the health and safety committee and the health officer. And then the code will end upon evaluation and implementation of the new plan. Results shall be strictly monitored again kasi nga PDCA, no? Plan, do, check, and act is just a cycle. No? If you have modified your plan, it has to be evaluated again. So, through a regular feedback session. Okay, so now we are on the detect. No? So, from the detect, isolate, and recovery, these are all actually based on standards that are set by the our uh, our specialists, no? Infectious disease specialist, microbiology, and also from the program. No? So ano po yung mga pinapatupad ng ating mga based on those standards set by uh, the specialists. No? So for the active and passive surveillance, so we have the screening at points of entry, regular self-monitoring and reporting, regular checkup monitoring of employees, and the reporting of clinics and disease reporting units. So actually for this, we have prepared algorithms. No? Kasi there is no better way of illustrating than by showing through an algorithm. But then again, this algorithm that we are presenting, we are not saying that this is the best, no? Actually, just to illustrate, but again, we are not being prescriptive about this. This can be adapted, this can be improved, or it can add on. So, i-reiterate ko ulit that every workplace is unique. So the only people that can say that these things will work for them are the employees, the management, and the clients. So just to illustrate the screening at points of entry, so ito po. So of course, papasok po dun sa ano, before entering, kailangan naka-face mask and face shield yung mga clients and employees. And then filling up of the health declaration checklist. So, and then temperature check din sana it's usually ang mga naggagawa po nito yung ating mga security personnel. If sana makasama din, no? Kasi as I've mentioned, lahat po dapat involved. Kasama din po sana sa training yung mga security personnel natin to do these things. No? Kasi meron po na sa security check or temperature check pero kapag may fever, hindi naman nire-refer. So they should be on board, no? Kapag nakita nila may symptoms or may fever, they should be properly referred to the appropriate authorities, no? And then it should not just be compiled na kailangan i-assess din yung mga health declaration checklist na to, no? So these are the things to. If walang fever, then you can proceed to the sa area where saan pupunta yung client or yung employee. But if they are fever, ito po yung gagawin. So pwedeng mag-recheck ng temperature. If wala ng fever upon the check, they can proceed. But if may fever, then they shall be referred to the clinic for assessment. So if wala naman pong clinic sa office, sa establishment, they could be referred to the nearest facility. So pag sa workplace isolation area, so these are for employees, guests, and clients with persistent fever, no, and symptoms. So meron po kasing nire-require especially sa private, no, a temporary isolation area para lang po ma-separate natin those employees or clients with symptoms dun sa wala. So these are important para po ma-prevent natin yung transmission. So i-assess po yung employee or clients doon. If ever, i-assess sila if that is a COVID-19 case ba? Probable COVID-19 case or not. If not, they will be given the first aid and they will be either be sent home or facilitated transfer to a health facility. But if it is a possible COVID-19 case, then mag-start na po natin yung yung ating magka-cascade po tayo ng proseso, like starting with the filling up of a CIF form, your case investigation form, and then inform po natin yung mga safety officer, health and safety committee, and then they will be referred to the appropriate facility. So please facilitate, no? If wala kayong transportation na ambulance sa workplace, no, then just facilitate. Transport to the nearest health facility or to the temporary treatment and monitoring facility provided by the local government. So, on the workplace isolation area, so for the medium and large establishments, these are all based din naman dun sa issuance ng DOLE and BPI. They should provide one room when we have 200 employees based on current reporting capacity. They must be situated near the entrance and then must have an adequate ventilation, must have its own toilet, and tents can serve as isolation areas. And then PPEs must be worn at all times. No? These are also based on the DOH Department Memo 2020-0197. So for the self-monitoring and reporting, these are self-monitoring and reporting of employees at the residence. No? Para po sa if you have that mindset of safety culture, no? You can monitor yourself kasi if you're going out every day, you're taking the public transport, you're being in contact with other people, you should monitor your health. No? So the least that you can do is you take your daily temperature and monitor for symptoms. So if you have no symptoms, no fever, you can proceed to work. But if you have symptoms and you develop fever, ito po yung mga gagawin. No? You immediately inform the supervisor or the HR officer or call the clinic health personnel through telemedicine. But if you do not have a clinic or health personnel's office, you can also uh, consult from a private practitioner. So you will be assessed, and then you would know upon that assessment if COVID-19 related or not. So the same thing, if COVID-19 related, magka-cascade na po yung ano natin, that you have to inform the safety officer, health and safety committee, and the HR. And then actually, if you are staying at home and then you develop a symptom related to COVID-19, the thing that must be done is to report this to the local government unit. And then at the clinic, if ever that the employee was monitored or found out to have symptoms while in the workplace, so ito po yung mga mangyayari. So, maa-assess po sa uh, OH clinic if it will be a possible COVID case or not. If it's not a possible COVID case, and then first aid or it will be facilitated yung transport nung employee to the nearest health facility. But if it's a possible COVID case, and then mag-start ulit natin yung cascade of sequence of events, no? Filling up of the case investigation form, informing of the safety officer, the health and safety committee, and the HR, and then facilitation of transport to the nearest health facility or to the temporary treatment and monitoring facility of the local government unit. But usually, ang nangyayari po dito, if the employee is residing at another city other than the place of work, ang mangyayari po nun is that they will be reported to the local government unit where they are residing. So if ever na it is a possible COVID, there are local government units who are facilitating transport. No? So sunduin nila, they would fetch the employee at the workplace or the where they are located, it's either at the PTMF or the nearest health facility or the establishment itself, and then they will be transported back to their place of residence. But if not, what we are asking for the establishments, the employers, or the workplaces is that to facilitate transport of this personnel para hindi po sila makahawa or they should be isolated from the rest of the healthy population. So for the clinics or disease reporting units, if the employee happens to consult a private facility or the community no, sa LGU nila, these are the things to do. So if they have visited the local government unit, RHU, or hospital, if possible COVID-19 case, they must be in, again, the HR, the safety officer, or the health and safety committee must be notified, and then at least alam nila that that person, that employee is have consulted the local government unit and is in the facility provided by the local government unit. From any clinics outside the disease reporting units like the private health facility, so these are the things to do. If the employee is diagnosed as a possible COVID-19 case, then again, these are the series of steps to take. So inform the immediate supervisor or the HR, inform the safety officer for the possible diagnosis, inform the OSH committee. And then inside the workplace, they could have actually start the series of contact tracing. It should also be important if that the establishment or workplace can have their own surveillance officers to conduct the contact tracing. So here, contact tracing among the workforce. So at the workplace, if the employee is a probable or confirmed case, ito po yung cascade, no? So mag-initiate po ng risk assessment in the workplace of every possible specific workstation. Of course, all the necessary have to be informed, no? Like the HR, at least the health and safety committee, the supervisor, and then inform agad yung decontamination and disinfection team. And then inform the OSH committee to collaborate with the LGB. So, mas maganda po, it is just recommended or encouraged that you should have your at least simple contact tracing team sa workplace. And then at the workplace, ang ati pong 24 hours max, we should do this as quick as we can kasi po to prevent exposure ng iba, no? Just in case that they don't know that they have been exposed to a person who is a confirmed COVID-19 case. No? So, report in suspect or probable confirmed COVID-19 case sa workplace and at the local government unit where he or she is residing. Inform the safety officer, inform the HR, health and safety committee, and then initiate the contact tracing. And then initiate the disinfection. And then for the targeted testing, actually, ang ating pong reference for this is the Department Memo 2020-0258-A or the the DOH Department Memorandum of Targeted Testing. And as of now, I think meron pong department memo that I have not seen yet regarding the uh, I don't know if this memorandum has been superseded, no, or rescinded. Uh, so it was issued by the Office of Undersecretary Virginia. We will look into it po, no, kasi we have not seen this. We have not seen that issuance. I think that is DOH Department Memo 2020-0429, if I'm not mistaken. And then also our reference would be the BPI DOLE Joint Memorandum Circular and its supplemental guidelines. So again, coordination with the management and then the Occupational Safety and Health Committee for testing. So it's either that the employer can provide the testing or it can be referred to the local government unit. So these are the cascade of events. No? So again, this has to be done as quick as we can uh, to facilitate yung contact tracing yan, to avoid possible transmission or exposure of other healthy individuals to a close contact of a confirmed positive. So everything has to be communicated and coordinated with the local government unit, especially on reporting and where to refer the employees for isolation, testing, and treatment. And then an important note is that we should remind all the employees that while waiting for the result of the, the testing or while they are their status has not been confirmed, they should actually isolate and quarantine themselves, no? Until such time that the test result has been issued. And then also based on the department memo on targeted testing, so these are the uh, priority workers that has to be tested how many times. No? So nakapalaob po yun dun, everything is in the department memo 2023-258-A. Unless po na that the new issuance rescinds anything or everything that is incorporated in this issuance. No? That is Department Memo 2020 I forgot I mentioned a while ago. 0429. I think, yun po. So, based on Republic Act 1152, all, kasi reportable po ang COVID-19, so all individuals awaiting for lab results should have completed running the laboratory test. Release of results are to the virus surveillance units. Ito po yung mga offices na tumatanggap ng Epidemiology Bureau, the RESU, and the other disease reporting units of the local government, the LESU, the MESU, or CESU. So, isolation and quarantine at the workplace or residence. No? So, all employees that are categorized as a close contact, suspect, or probable um, should isolate or quarantine or observe isolation and quarantine protocols immediately after being informed. No? And then determine what type of facility or isolation quarantine. And again, inform the supervisor or HR officer on their whereabouts. So they should be monitored. No? And then if ever, if they need the following support like food, they should be provided with it. The employer, the establishment, or the workplace should provide these things to them. They should be reminded to observe the quarantine period, or they should proceed to the TTNF isolation facility or to any level 2 or 3 hospital if ever that they're experiencing severe symptoms then. So, on the part of the OHS committee and the human resource officer, so the OHS committee should ensure the presence of a strong linkage, no, as we have mentioned earlier. We should ensure the strong private and public linkage, no, and also with the established referral system. So that referral system naman is all government, no, or the LGU, the BHERT, or kasi dito sa the NCR, meron tayong one hospital command. And then ensure linkage with the LGs for the use and referral of their isolation facilities or temporary treatment and monitoring facilities. And then on the part of the HR officer, they should ensure that all close contacts are given sufficient information, that ensure that all close contacts undergo the quarantine or isolation while waiting for the test results. As I mentioned earlier, they should be reminded that they should not expose other people while waiting for the result. And then recommend special work arrangement affected employees. And then facilitate provision of mental health and psychosocial support, transportation or financial support to affected employees. These are all encouraged lang naman, but it's not mandatory. Kasi not all employers can afford to provide these things. So on the localized lockdowns, so actually we have established workplaces as to first an office or an office within the floor if the building is large, and then a building within a compound. So yun po yung mga ating mga designated no, when uh, the management or the workplace or the establishment is considering lockdowns. No? So we are actually looking for cluster of cases. This is the thing in consideration when one is considering localized lockdown. So cluster of cases refers to the presence of two or more cases of either a suspect, a probable and or a confirmed COVID-19 case, or at any possible source of transmission until proven otherwise with epidemiological link aggregated in a certain area per time period. So yung certain area that we are mentioning is this, no? So for an office or workplace unit shall be categorized as a critical zone or lockdown area if at least one case of either suspect, probable, or confirmed COVID-19 has been physically reporting in the last 14 days. No? So these are all based on the uh, uh, evidence of yung ating incubation period. No? And then building floor shall be categorized. So a building floor may have several offices in that floor. No? So it can be considered a lockdown area or critical zone if at least two cases of either a suspect, probable, or a confirmed COVID-19 case are present in two different office units in the same floor and have been physically reporting for the last 14 days. So magkaibang office, merong cluster of case. An establishment or building is a critical zone or lockdown area if at least one cluster of cases composed either of a suspect, probable, and confirmed case where individuals have been physically reporting for the past 14 days. So establishment building means that merong mga one cluster of case existing within that building, either in an office or a floor. No? It can be considered as a critical lockdown area. There is one cluster of case composed of the suspect, probable, and confirmed case in different floors or different office. And then for a large establishment building, to be considered as a critical zone or lockdown area, at least two clusters of cases composed of either a suspect, probable, or confirmed case has been reporting in different floors where the individuals identified have been physically reporting for the past 14 days. And then for an establishment building complex composed of several buildings, no? For interconnected buildings, shall be categorized as a critical zone or lockdown area of at least three clusters of cases composed of either a suspect, probable, or confirmed case have been reported in different buildings where the individuals identified have been physically reporting for the past 14 days. So compound, these are composed of different buildings na rin, no? If there are at least three cluster of cases composed of either a suspect, probable, or confirmed COVID-19 has been reported in different buildings. No? So, so yun lang po yung ano, no? If you can, if you will, recognize that uh, for an office na merong confirmed or suspect, pwedeng lockdown ng office itself. In a floor composed of different offices, pag meron pong cluster of case in one or two offices, you can consider locking down the entire floor. If the building, if one office in different floors or two offices in different floors have cases, cluster of cases, you can consider that building as a critical zone or lockdown area. For a compound, if there are a cluster of cases in different buildings uh, in the same compound, we can consider the compound as a lockdown area. So, ganun lang po yung, so, we just subdivided, say, for example, a very large compound with different buildings and meron existing na mga cases there in different buildings. So, you can consider the whole compound as a lockdown area. But then again, ang question dito ng especially dun sa mga private establishments that we need not maximize the 24 hours para po to resume or to go on operating. As long as nasunod yung disinfection standards and that we have used the proper disinfecting agents. As we have mentioned, kahit na even before 24 hours or even after 8 hours of cleaning, we can already resume work. No? So again, ito yung in contention po, no? Kasi some of the workplaces that have or has been reported to the local government unit or the local chief executive, when they declared it as a lockdown area, ang makakapag-lift lang po nito yung mga municipal mayor. But when I presented this operational framework to the National Task Force sometime late August or early September, present po sila task force chief, they have a consensus that pwede naman po mag-decide yung workplace itself as long as na comply na yung disinfection standards that we can resume working even uh, even before 24 hours has passed or without maximizing the 24 hours timeline. No? Kasi po since that we are in the phase 3, no? We are getting towards recovery. And as I've mentioned that establishments, employers, industries that every minute, every hour counts, and every worker or personnel counts for them to operate. So we should not burden our industries with this. Kasi nga, we have been affected much, and then so does our economy now. And then now that we are trying to strike the balance between health and economy, so yun po ang ating consensus about that we can actually we cannot maximize na yung 24 hours as long as nasunod po yung disinfection standards. So again, yung lifting, so ito po yung discussion yung lifting of the critical lockdown area. No? So meron lang pong kinalaman to sa disinfection and also on number of personnel that has been affected. So for the treat, on the part of the Occupational Health and Safety Committee, they should ensure that all employees are enrolled in field health or other HMO. And for the public sector, sa GSIS. No? So, kasi po, COVID-19 is for other workplaces other than health facilities. They are just work-related, no? But they are compensable. COVID-19 is only an occupational disease in facilities handling the patients in the disease itself. But other than that, all other workplaces, work-related lang po ang COVID-19. But it is compensable naman po. So, the committee and the management must ensure that all employees are enrolled in this social protection programs. No? And then ensure the presence of a strong linkage with the established referral system. Again, if you are referred to the government, local government, national government, all other expenses like the testing actually can be provided for free. And then the human resource officer shall regularly monitor the status of the employees admitted to the hospital. But in case that the patient is severely affected in severe condition, you can actually consult the nearest relative taking care of the employee. But for employees that are with mild or moderate symptoms and can still communicate, the HR officer must monitor the status. If not, check on their condition. This is also a sort of a mental health and psychosocial support for the employees that they know their employees are concerned for them. So aside from the financial and other logistics, very important ways to provide mental health and psychosocial support. So for the recovery and integration, ito po yung in order to discuss this, ang ang key element po dito is if the employee has consulted a private clinic or private health facility, they should secure a health certificate of their test, of their treatment, and then or isolation, and then they should present this to the HR officer or the Occupational Health and Safety Committee or the clinic personnel for them to be cleared to return to work. If they have consulted the government facility, then they should acquire those things also to be presented at the workplace. So if the workplace doesn't have an OH clinic or OH personnel, you could always present these certificates to the HR officer. So yun lang naman po yung that. And then once that they have been allowed to go back to work, if may program po ng reintegration yung workplace, then doon na po magkakascade yung they can be provided instructions on how to return to work. Again, observance of the minimum public health standards. And then also on provision of mental health and psychosocial support. So yun naman po yung key message for this partner recovery and the integration. So basta po, every thing that they have consulted, either a government or a private institution, they should secure, and those institutions should provide naman certificate of what they have of what the patient has underwent in the facility. Either they have tested the patient, they have provided treatment, they have provided accommodation or quarantine area. So they should be issued certificates of those things. Na na ipipresent po ng ating mga employees to the HR or the clinic for them to be cleared for work. So, ang gagawin naman po ng clinic or HR personnel is to validate, verify that these things have been done or the employees underwent these things. So again, for the OHS committee, collaboration with the local treatment facility or the LDE must be done. And then for the HR officer, facilitate provision of mental health and psychosocial support to the employee and their family, and then ensure smooth integration of the employee to the workplace. So, maraming salamat po. Thank you very much.
Was a very comprehensive presentation. That was very intense. That was a very comprehensive presentation on how we are going to prevent and manage COVID-19 in the workplace. I'm pretty sure our participants are very much excited to ask questions. So let's give a hand to our speaker, Dr. Valeriano B. Timbang Jr. Thank you so much, Doc, for sparing your time for Caraga region.
You're
And
welcome po, ma'am.
yes po. Thank you so much, Doc. So at this point in time, we will now be answering the questions. So the floor is now open for the questions, but we will be getting our questions from menti.com. Ayan po. So I think the questions are already flashed onto your screens. Let's go to the first question from our participants. Under what provisions, let's start with the first question. Under what provisions are the contract of service or job orders secured to have benefits in this time of nationwide health emergency? And should concerning agencies promulgate this thus immediately? Doc?
Yes, so actually, on the part of DOH, actually, this can be answered um, mas maganda po, no? Civil, well, we're talking about the government workers, this can be answered well by the CSE. No? And then on the side of the private establishments or private employees, this can be answered naman by the DOLE, especially the Bureau of Working Conditions. But I've heard dun sa mga forums when we are together that sa Civil Service Commission po, I think there is an issue once po regarding the work arrangements and the benefits. I just don't know yung exact issue once. But I've heard the Civil Service mention that regardless nga po of employment status in the government, whether you're under contract of service, that meron pong mga benefits din yung ating mga job orders. And then, under naman sa private establishments, mga private employees, actually, dun sa issuance po ng Dita Idole, they have mentioned of mga benefits, no? But again, I think kailangan din pag-usapan pa. Yung na-mention ko kanina sa ating presentation that all employees have to be informed of the policies na implement ng employer, no? should this concern yung mga workplace entitlements, so kailangan sila well-informed and kailangan silang part of the decision making. So I really cannot answer directly, but yun po yung mga ano, but if to answer what issuance says, dun sa CSC naglabas po sila ng mga memorandum circular specifically sa time of COVID regarding alternative work arrangements and other benefits. And ang reference po natin to the private would be the DI guidelines, I mean, supplemental guidelines on COVID-19 response to workplace.
Okay, thank you, Doc. Let's go to the next question. So our next question is, there are those who are asymptomatic and symptomatic individuals with COVID-19. How will we address this, especially that not all who goes on duty will have high temperature in cases where are unknowingly positive for COVID-19?
Yes, so actually, problem po talaga yung asymptomatic cases. No? But dun po sa ating targeted testing, those workers naman po can be tested. No? Should it be provided by the employer or under the facilities provided by the government for testing? So, meron po naman dun sa Department Memo 2020-0258-A on how often and sino yung mga um, uh, pwedeng i-test, especially yung mga essential or mga frontline workers. So, with regards to asymptomatic, talagang actually it's sa problem din po talaga. Kasi po, for those symptomatic, if they develop symptoms, madali po natin malaman at agad-agad pwede natin ipa-test and then trace all those contacts. But for asymptomatic, malalaman lang po natin na positive sila if sometimes they have been exposed then to a confirmed COVID-19 case. But then again, ang tanong doon, sino ba yung nauna? Is it the asymptomatic case or is it the one that produce the symptoms and identify them as a close contact? No? So we would never know. But yun lang po. If only we have the capacity then to do mass testing. No? Kaya lang at this point in time, talagang ang ina-advocate lang din po natin is targeted testing. So we will only have that high level of, if we have that high level of suspicion, saka lang po tayo makakapagpa-test. And then yun lang po, vigilance lang din po, kasi talagang problem po yung asymptomatic. Kasi wala pong symptoms, walang fever, and you will only know if you have been tested. So, ang ano po dun sa ating present is on the only thing that we can do is to monitor. If we will be developing symptoms or not, or if we will be exposed to one. So, for sure, one of those contacts na asymptomatic will develop symptoms and mati-trace back din dun sa. So, I think that, this is my personal, it's not really written or anything dun sa ating mga issuances. For clinical practitioners, for doctors, or like talagang it will pose a problem if we cannot conduct mass testing. But as of this time, because of our limits in testing, in terms of resources and so talagang problem po talaga yan. Ang ano lang dito is vigilance and then do self-monitoring. And then we're talking about workplaces, So the workplace that has the capacity or the ability to monitor their workers, pwede pong gawin naman nila yun through their occupational health and safety clinic or their OHS committee.
And if I may add din po, Doc, no, since we are talking of asymptomatic individuals, it would really be good if all of us will follow the health protocols. Kasi whether asymptomatic or symptomatic, as long as we practice the health protocols like wearing of mask, physical distancing, the basic things that we have to do, especially in the workplace or stay in our work area. I guess in such a way we can also protect ourselves and our colleagues. So let's
Yes,
now
so
go
you're
to
right. Mhm. Thank you for that.
let's
Thank
now
you.
go, Sige po. Thank you din po, Doc. Let's now go to the next question. Is occupational health and safety an office where every agency, whether it's private or public, should have? So parang, is it mandatory to have an office for occupational health and safety? And if yes, what directives do we have that requires its establishment?
Okay. Um, for the private establishments, actually it's under the labor code, no? Especially yung implementing rules and regulations ng Book 4. So I'm not from the Department of Labor, but just knowing that they have that issuance, yung implementing rules and regulations ng Book 4, yun po yung tinatawag nating occupational safety and health standards. So nandun po nakapaloob for the private establishments that they should have health and safety committee. Actually, it's not really an office. It's just a committee that you can form without a physical office. And that this committee can be convened, no, regularly to develop and implement health policies within the workplace. And then also if hindi po alam din ng nakararami that on the part of the DH, meron din po tayo dun sa PD 856, yung ating Code on Sanitation of the Philippines, especially yung Chapter 7 on Industrial Hygiene, wherein kailangan po ng ating mga private establishments na if they can convene sila ng gawa sila ng occupational health and safety committee within the workplace. Specifically to address yung hazards sa workplace. No? Yung na-mention po natin na physical, chemical, biological, and other ergonomic hazards. So hindi lang po DOLE ang may issuance na yun, kundi pati po ang Department of Health. And now that sa atin po sa Department of Health, we have been working together with the other agencies that are primary players in occupational health and safety, like the Civil Service Commission. Yeah. Now, for the public sector, meron na po tayong issuance that is a joint memorandum circular, no? Between the CSC, DOH, and DOLE regarding occupational health and safety in the public sector. So, doon po nakapaloob that required or actually unlike the public sector, hindi po natin sila ma-regulate. We cannot self-regulate sa government. But since the Civil Service Commission acting as our sort of human resource office for the public sector, we have issued such memorandum circular that we are all encouraged or enjoined to develop this committee and also to do the same, implement and develop and implement policies on occupational health in public sector workplaces.
So thank you for that, Doc. So basically, we can assign people to be a part of that committee. Let's now go to the next question. So our fourth question is, if you are one of the personnel facilitating the burial of a certain COVID death with complete personal protective equipment, are you obliged for 14 days quarantine and RT-PCR swab test?
If you are wearing a PPE, you are not really obliged except for the schedule. No? Kasi under the Department Memo 2020-0258-A on targeted testing, that as such personnel, no, facilitating burial or if you are part of that frontline personnel handling this, meron pong schedule ng testing. No? So I think if I'm not mistaken, under that memorandum, I think every 14 days ang testing. So you could be tested as it could be tested regularly, so as to ensure that you do not contract the disease.
Okay, let's now go to the next question. I think this is okay. Our next question is: how about providing free anti-flu vaccine or anti-pneumonia vaccine to employees?
Actually, for private establishments, actually this can be part of their health program. But for I think for the government, I cannot say if allowable under the um, accounting rules and regulations ng COA and BBN. Uh, uh, Government offices or their heads uh, um, can actually provide this. Um, Yun po yung ano, medyo may konting ano din sa part ng public sector wherein we cannot just use funds no for ano. But for private establishments, pwede po itong maging part ng health program ng isang establishment. So probably I'll ask pa if the civil service or if the DBM will allow no hindi lang provision of vaccines but also we're also encouraging or uh, advocating to provide certain medicines and ano vitamins no just to ensure the healthy yung ating mga employees no? But under the ano public sector sa government po yun po yung medyo may ano unless it is allowed that if the agency or the office has provided in their work and financial plan yung funds for this. But I don't know if it is allowable din. Or meron kasing health programs that we are implementing no dun sa family health and sa degenerative disease office regarding yung provisions of these vaccines or services, but they can actually avail of this din sa ating mga local health units, din sa ating mga RHUs. So if it is available, they can actually uh, access it there. But dun sa office planning per se, that even if we have health and safety committee sa government offices, I really don't know pa how this will work. No, kasi nga we cannot just allocate funds or resources for this. And then also that JMC is also a bagong issuance lang, so kakasign lang. So we have not had the time to discuss yung mga implementing mechanisms nito. So I think in the next interagency meeting with DOLE, CSC, DH, and other stakeholders, baka mapag-usapan yung provision of this type of privileges or
Program. Yeah, that's actually a good idea, Doc. No? Baka hindi lang pa kasi nakita yung angle na yan wherein for government agencies, they can actually have programs wherein they can avail the vaccines. But we will also be looking into the guidelines as well kasi may guidelines din po tayo for the flu vaccines. But with the private sectors, that's actually a good suggestion wherein they can have a program and allocate a budget, especially for their employees. So perhaps that would be one of the steps that we'll be looking into programs for the government agencies, especially the public sector, how they are going to get possible vaccines, especially for the employees. So thank you for that. Let's now go to the next question. How should employers decide when to open, close, and reopen workplaces, suspend or downscale work activities?
Okay. So, as we have mentioned a while ago during the presentation, that Um, well, if this is related to the lockdown, no, or of having cases in the workplace, no. So, andun po sa presentation that we have divided the workplace into several areas. Pwedeng office alone, a floor, the entire building. No? So, if should there be cases in an office or in a floor, two offices in a floor, or cases in different floors within the building, then you can decide to lock down the place, disinfect before reopening again. For those who have not actually resumed operations since ECQ, since March, and then they would be allowed to operate again. Dun po sa we will refer dun sa first part of my presentation regarding workplace assessment, yung risk of transmitting it, depending on the work process, kung ano yung ginagawa nila. So, if it is a healthcare facility, of course, andun talaga yung danger because you're handling cases of COVID-19, and then all the resources and should be provided, and also yung rotation, that is administrative control, no? Yung rotation of personnel. There are some health facilities na ginagawa nila regular testing and rotating of personnel, especially dun sa COVID ward nila. But for workplaces, if you have categorized your establishment as you cater to clients. So this is for both, no, public and private. Kasi especially sa government office, example, LTO provide ng services for registration of vehicles and renewal of licenses. No? So they cater to clients na pumupunta mismo doon, physically yung mga clients. So this is a moderate risk. No? So you have to assess if you are ready to do this. No? So again, i-check mo yung work process, yung risk mo, and then what are the things you have in place. So do you have barriers, no, for your engineering control? You provide barriers between clients and the employees. And then you also consider yes, the alternative work arrangement. If a lot of your employees naman can work from home, then why not? No? So, yung mga ganun po, it is actually, until now, uh, it is still accepted, and then may issuance po ang civil service regarding that for the government workplaces. Pwedeng mag-implement ng alternative work arrangement. And also for the private sector, andun din po yan sa issuance ng DOLE, that if they can, they need not be physically present sa office. They can work from home. Provided that you also check for the connection, no? Connectivity. So that's how to do it. No? If you are not operating, and you will be allowed to operate, you assess the workplace, your work process. If you are categorized as a high and a very high risk, so you do all the necessary preparations. And then if you are considered a moderate or low risk, you also have to do the necessary preparation. So yung mga nabanggit ko that you have those plans in place, yung mga plan na yon, if you implement it, you have to convey or to communicate it well with the employees para alam nila kung anong gagawin, they know what to do, or they know what to do in case of. No? So what are the policies na ipapatupad mo? So those are the things na gagawin ng isang workplace if they wanted to operate, or while operating wala pa sila, they should do all those things. And then again, if they are talking about the lockdown, ando naman po yung sa binigay ko sa presentation that you have to identify if you have clusters of cases in a particular place, just an office itself, or different offices in a floor, or different floors in a building, or you have cases in different buildings within a compound. So, and then issue nga din with the private establishment, the resumption of work after lockdown. If they have complied with the disinfection requirements, and we have issuance naman on that. then they need not maximize the 24 hours. They can operate again even before 24 hours after disinfection.
Yes, Doc. So it's really important to have an assessment before we go to full manpower complement, right? And we try to look at again and assess the structure of the building and check our protocols and policies. And you made mention of the connectivity because earlier we also had a challenge with our connection. So it's really
Yeah.
one of the challenges with the new normal right now and how we're going to work and how we are going to perform our responsibilities, especially at the workplace. So let's now go to, we will be catering three more questions. And before we end the open forum, so this is the third to the last question. May mga directives na po ba sa office regarding ventilation and air conditioning, especially na may mga lumalabas na news about COVID na as airborne?
Oh yes. Actually, the CDC, WHO, and even the Department of Health has already acknowledged that the possibility of or airborne yung SARS-CoV-2. Yung SARS-CoV-2 is the virus causing COVID-19. So that's why we have issued, I can't remember the issuance number, but it is from the Health Promotion Bureau that they have issued the ventilation standards in workplaces. Um, so actually, this is even if wala po tayong na issuance or directive, what we are promoting is for every especially for close spaces, no, na talagang walang windows or that they should encourage yung opening of doors, opening of windows, or additional kahit simple electric fan to provide air exchange, no. Just yung mga closed spaces, if they have windows, may door yan. So you have to open the door. So ang danger lang din is if you keep on inhaling yung recirculated air na nandyan lang din yung ating SARS-CoV-2 virus. So mas maganda po, we are advocating for uh, uh, the place to be continually aerated or may air exchange po talaga, no? So even in sa transportation, kasi marami po ngayon yung mga shuttles and services na air condition, uh, okay, na recirculated air, no? So kailangan po tayong magbukas ng window, or if hindi kayang magbukas ng window kasi they are not built for that, probably they could consider using yung mga na-mention natin mga HEPA filters. But then again, I'm not promoting yung HEPA filters. I just encourage to use kasi this is also important that we could filter out some of the hazardous particles and biohazard. So talagang we are advocating, and we have recognized din naman that it is airborne, or the possibility of it being airborne, and then that we have issued those memorandums for regarding ventilation. So recirculated air is not recommended. Air exchange, yung frequent air exchange by opening of windows and doors, yun po ang ating uh, ina-advocate po. So not only for workplace, but also on public transport. Kung yung public transport naman po, like yung sa let's say jeepney na open naman po, so use of face shield and mask is okay na naman din po. So kasi open naman po talaga siya. So nag-circulate ang air doon.
All right. So I think needs to say din po, Doc, no, ventilation is really important. And we'd like also to emphasize, kasi di ba pag closed area po talaga, umiikot lang po yung hangin in that certain area. So sometimes when we have trainings or discussions wherein kahit 10 lang po yung nag-attend, we always encourage to open the windows para talagang lumalabas po yung hangin. But again, kung ang issue is mainit, that's why they turn on the aircon, then the physical distancing comes in. So hindi na masyadong mainit kasi nga we have to be less than 1 meter apart with each other. And that is also complying to the health protocols. And if I may add lang din po, Doc, no, the Health Promotion Bureau, yes, issued AO 2020-0015. Actually, it's a DOH wherein we will be looking into the different public health standards to minimize risks for COVID-19. So probably our participants can also check on that. Let's now go to the next question. This is the second to the last question. We actually have here a question from our participant from the Zoom cloud meeting po, Doc. One of the participants stated that it's quite ironic that public health workers sometimes get or contracted the virus while they have in place health and safety protocols. Kasi di ba po, may mga confirmed cases po tayo ng mga healthcare workers. And the protocols are designed to form desired behaviors, but unfortunately, still there are open violations. So, do we have an enabling measure to define, to penalize violations of the protocols?
Actually, on the part of Department of Health, being a non-regulatory body, so it's really difficult to monitor or ano. But we have attached agencies that pero hindi not to monitor yung mga violations such as violation of minimum public health standards. I don't know, probably if we can consult yung health facilities development bureau natin or yung health facilities regulatory and services bureau. I don't know if they are conducting monitoring of health facilities, no? For the public health workers that are assigned or employed din sa ating mga DH hospitals or din sa mga local government unit health facilities. So I really, well, on personally, I don't know of any bodies that are regulating po on that. So that's my answer on that personally, except if they know that meron po. But for the private sector, private establishment, nagmo-monitor ang DOLE, but not for private health facilities. So iba rin po yun kasi ang nagmo-monitor po sa private health facilities ay also DOH. But to what extent, if we are talking about yung minimum public health standards, so I don't know if namo-monitor din po ng DOH or ng DOLE or probably the LGU. No? So that I really cannot answer directly. And then can only speak or answer personally and as knowledge on that the Department of Health is really not a regulatory body on that. So yun po, actually it's one of probably one of the ano po, na we have to look into, and sa gap din na we have to fill in, no, kung if the minimum public health standards, especially for the healthcare workers or public health workers, nasusunod or there violations, no, pertaining to sa facilities mismo nila, or them being a health worker na not following the health standards being imposed or uh, promoted by the Department of Health.
Yes po. Thank you for that, Doc. And we also have to remember that there are different factors, no, that can play in between, which is why some of the healthcare workers are affected. So it's really important that we check again our policies. So baka may mga practices na pwedeng lagyan para din ma-improve yung pag-follow ng ating mga health workers in terms of really implementing the minimum public health standards. I guess we're now down to our last question. So, actually this is in Bisaya, but I'm just gonna read it first po, Doc. If meron po bang mag-positive na COVID sa isang ahensya or office, kailangan ba talagang mag-lockdown ang buong opisina or the entire office?
Okay. Again, basing on our ano, yung sa a presentation a while ago, and that was actually discussed now with the NTF and sub-technical working group on workplaces, no? So, ang pag-lockdown po is again, mentioned po, based on now, para hindi po so as not to interfere with the work or the mandate of that agency or government. So ang lockdown po na i-implement natin is, as I mentioned, we would divide the workplace. No? If it is a large establishment talaga na public na government office, composed of different buildings in the compound. An office can be locked down. You can only lock down one office if in that floor siya lang yung meron, no? Hindi siya lang yung cluster of cases. But in office building with different floors, and in that floor, different offices ang magkaroon ng clustering of cases, sila lang yung ila-lockdown, not the entire building. So yun po ang ating susundin na process. And then after disinfection, you need not let 24 hours pass by bago mag-resume ng work. So pwede na tayo mag-resume even after 8 hours or less than 24 hours. So yung sa binigay ko po kanina, pwede po natin i-share yon. And then lalabas po kasi yung joint memo circular once na mapirmahan ng secretary, and then once na nag-agree, and then nag-sign na rin po yung secretary, Civil Service Commission commissioner. No? So, it will be a joint memo circular, and yun na po yung susundin natin. So, based on that, you need not lock down the entire place. No? If the clustering only happened in one office, and that office alone would be locked down. But in a floor within the building, may dalawang offices, you can lock down the floor, but not the whole building. So, ganun po ang mangyayari. If in a building, merong different floors na may cluster of cases, you can lock down that building. And in a compound, if you have cases in one building, in different floors, and you have other cases also in different floors in another building, in the same compound, you can lock the whole compound. So, ganun po yung magiging process natin with shutting down, locking down, or pag-cease ng operations. So, yun po yung susundin natin.
Able to get a lot of questions from our participants. Although we were not able to accommodate all, we encourage other participants to contact the DOH regional office for clarifications on some concerns. But rest assured that we will be facilitating kung ano naman po yung mga doubts na ating different workplaces and offices at the region. So that was really intense, and we are glad for the enthusiasm of all our participants. I guess that was a really fruitful discussion. Thank you so much, Dr. Valeriano B. Timbang Jr., for really sparing your time for Caraga region and explaining well what are the practices that we can adapt, management and prevention practices for our workplace. So this is a very rare opportunity po to join with us. At this point of the program, to show our overwhelming gratitude for your time, Dr. Timbang, we would like to present to you this virtual plaque. Virtual plaque lang po muna. Doc, kasi po, ang hirap po talaga, but we'd like to give you this token of appreciation for giving your time for us. And we request a virtual applause din for your performance din po today, Dr. Timbang.
Thank you.
Let's show the virtual
I hope hindi nagbago yung mood ng ating mga listeners from happy to sad. But I guess, I'm sure na marami ang hungry. So,
I'm pretty sure marami ang hungry, but again, this is a once in this is a rare opportunity for us to invite them and go on live on Facebook. So ayan po, Doc, allow us to present to you our token of appreciation through a virtual plaque. So ipapadala po namin yan sa inyo anytime soon. So, may mga revisions lang po kaming lagyan. That's Dr. Valeriano V. Timbang Jr. Kasi junior din po yung regional director namin. So
Yes,
very important
opo.
po yung
Yes,
junior na
yes,
part.
yes.
Ayan. So again, thank you for your time, Doc. Now we are really almost done. It's almost 1 p.m. na po, but we're happy that a lot of our participants are still here. Gamay na lang yun. Gamay na lang yun. Mahuman na yun ta. We would also like to thank all our participants for joining, especially to Dr. Janice Alcordo, Dr. Arturo De Jesus of PhilHealth Caraga. We also have Regional Director of PopCom. Ayan po. We have a lot of Regional Director Alex Makinano. And then we also have a lot of other participants who joined us. And at this point in time, because we are happy of the participants, different participants joining this activity, we will be conducting a raffle. Ayan po. We will be giving away freebies. Papakita ko lang po yung freebies. Ito ba yung freebies? Wala ba tayong music dyan? These are thermal flags and we will be giving this away to our participants. Kasi po, nagutom na po tayo, but nonetheless, we've learned a lot for today. Dami nating natutunan. Ayan po. And we also have t-shirts. So we will be randomly picking winners from our list of participants through our roleta or our roleta, ayan po. And, ayan, so ang dami-dami nating participants. Our wheel of names, we will be randomly choosing a lucky winner. And the lucky winner will get a DOH prize. Oh, our first winner! Mr. Jose Sosmeña. Congratulations po. Congratulations po. Let's now go to our next lucky winner. Kasi di ba nagpagod po tayo, it's almost 1 p.m. So we want to give this back to you guys for staying with us. Let's now go to our next lucky winner. Oh, we also have our next winner, Miss Joy Mazo. Congratulations for your thermal flask. And then for our third winner, ayan po, congratulations, Miss Gloria Bascon. You won a 1 thermal flask. We still have 2 items left here. Let's now go to our next winner. You actually have a t-shirt. Congratulations po, Mr. Ace Kabuga. And the last winner, congratulations po, Oscar De Jesus. Oh, that's so nakaka-happy po yung part na yun. So to all our winners, claim the DOH prizes at the regional office or DOH Caraga, that's Pizarro Street Corner, Narrow Road, Butuan City. We are open Monday to Friday, 8 to 5 p.m. Just look for Miss Arami Inayon or contact her first for claiming instructions. You may contact her at 0949 871-7119. I repeat, Miss Arami Enayon, contact her at 0949-871-7119 or email at eoh.caraga@gmail.com. So if you would want to come here and get your prizes, please wear your face mask and face shield because you won't be allowed to enter the office if you're not wearing one. So thank you so much for joining. And now we are finally at the end of this activity. May I call in another selfless public servant of the health agency. We'd like to call in the Local Health Support Division Chief, Dr. Ernesto Pareja, for the closing remarks.
Ay, ano na, paniwag to na. It's lunchtime. Okay, so marami akong friends. Ang dami palang participants. Si Director Makinano, sabi ni Romlin. At iba talaga mga doctors, nandito lahat yata, mga LGU staff. Please accept our love greetings. We hope you and your family are safe and being well amidst this COVID-19 pandemic. As we navigate through the rough seas of this COVID-19 pandemic, our dedication, our commitment to give services, especially in our respective agencies, offices, remain unchanged. However, amidst this pandemic is a call for a new normal of managing our offices. Today, we're very fortunate to have one top caliber speaker. That's Dr. Valeriano Timbang. May kaklase akong Timbang noon pero baka kapatid mo yun, Doc. So, he took on keeping us safe and healthy in the workplace amidst the pandemic. Maraming salamat po, Dr. Timbang. As I will always say, our task in the workplace is always moving and in fact advancing too. And with the right knowledge, we can prevent the spread of coronavirus in the workplace. Each one of us have a unique path right now, like us senior citizens. Sa amin, pag senior citizen ka, immunocompromised ka, 1 day work, 4 days home. Pero sa akin, everyday ako. While others are having also regular days work. Nevertheless, we still value safety or wellness in the workplace. As I always say also, our lives need extra care. Sana hindi tayo maging careless. Doon tayo nagkamali minsan eh. Naging careless tayo. Alam na natin na kailangan ng face mask. Masyado tayo mayabang, masyado tayong kumpiyansa, ayaw natin mag-mask o mag-face shield. So, follow the health standards, the health protocols. Hindi tayo maging careless. Yun talagang pinaka-word dito eh. Huwag tayo maging careless. So with this, join us now for this new normal of moving ahead and rising high against this pandemic. Congratulations to the organizers. Ma'am Romlen, ang galing mo talaga navigate. Sila Engineer Navarro, sila Arami, to all our organizers and participants, maraming salamat po. In behalf of Director Jose Ariacuna Jr., maraming salamat po again and God bless.
Mag-photo ops. So thank you very much, Dr. Pareja. I can see the screen of all our participants at the Zoom Cloud meetings. Ayan po, sila wave hi and hello. Thank you very much for really sparing your time with us. It's already past 12, but you're still here and you're still alive with us. And we will always keep that in mind, yung sabi po ni Dr. Ernesto Pareja that we must not be careless. So we must always keep in mind, although it's really going to be very challenging kasi it's a major adjustment. You have to wear masks, you have to be physically distant to people. But I guess with constant practice, we will be really able to adapt all those new health protocols. So we can also Static po tayo ng konti so that we can get the screen captures from our team. All right. Thank you very much for opening your cameras and thank you very much for joining us in our activity for today. It has been a fruitful day. We would like to thank everyone, especially our viewers on Facebook and to our speakers. This has been a very exciting and inspiring event. This has been Romelin Toralba, HEPO 3 of DOH Caraga. Let's keep our workplace safe and healthy. Let's take care of each other. Together, we will beat COVID-19. Good afternoon, everyone, and God bless us all.